pertains to emerging technologies, I think I was very excited to be part of this meeting, and I told myself I'm going to go and learn and see how this new information can complement the work we do, and see how we as a REC can tap into the expertise that exists, and then we can also roll this at our level. Thank you so much.
Thank you so much, Dr. Harriet, for sharing on what you're doing at IGAD, and of course we hope that being here provides the opportunity to create links and networks, ideas for your plans. Would like to invite SADC to share on their ongoing initiatives. Welcome, Dr. Namboli.
Confused now. Technology workshop, that's it. Okay, that's fine. Thank you so much. I'm just. To the details of different initiatives in member states, I'm going to focus on what is being done regarding digital health, and also where we stand as a region to improve the digital health. As you all know, SADC is the Southern African Development Community, made of 16 member states, with a population approximately estimated at 400 million. And we are having different challenges on top of the non-communicable diseases. We have TB, HIV, malaria, which is affecting our countries in different parts. There's also importance in terms of data sharing, facilitating especially data sharing at regional level, and also that coordinating, sure that coordinating response that we've seen has been lacking during the COVID-19 pandemic. So those are the basis on that. And in terms of technology, if I may put it that way, and the data system, member states are at different levels in developing systems and data, but what we can be sure in different countries and all member states, we have health systems, we have data collection tools which are being used for the collection of information, but also analysis. And at regional level, we have basically the protocol on health and the protocol on science and technology and innovation, which lay the foundation for data sharing and also the use of technology for health purposes. Recently, we have been working with different systems, trying first to have a regional database which will help member states to share information, but also coordinate together. This has been a long process, a very difficult, a hard process, mainly because of the issue of data protection. You all know that when it comes to data, there's issue of sovereignty, there's issue of challenges like in terms of which kind of information a country can share with another and which should not be shared with another country. So all those challenges are coming on board, and you have to take that into consideration. But we've been through some projects, we've managed to have some kind of platforms which are helping the region to address a few challenges that you'll see. As those are named there, we've spoken about the cross-border referral system, the SADC medicine database, the CTMS, which is the corridor trip monitoring systems, which works mainly within the transport, and also other applications and AI, which has been developed by different member states within the region. For the cross-border referral system, just to give a glimpse of it, this is a system we chose, used mainly to facilitate referral of patients between different member states on the management of tuberculosis. This one, we started mainly with TB management across border in terms of referral, and it's been given the advantage and also the acceptability, which has been somehow a bit higher than expected. within member states. We are now moving toward expanding it and using it for other diseases, which we expect that in the next future is going to be used as the regional health information management system. So we are more likely to move it. But for now, we have it in 10 countries, and among the 10 countries, all the officials and the officers has been trained to use it, and also they're using it for patient referrals. On the next slide, which you're gonna see, we're talking about the SADC medicine database. This is also one of the points that technology has helped us to put in place. This is mainly has been used in terms of sharing information for database, and especially for the implementation of what you call the SADC Food Procurement Initiative, which is managed from the United Republic of Tanzania. This has been mainly to facilitate, to help also country to share information about medical commodities and the prices, the bargaining, and also improving the bargaining power and ensuring that they access quality medicine and health commodity at an affordable price. That's also another regional initiative which has been there. For the corridor trip monitoring system, this has been first initially implemented for tracking the different transport and trucks for the private companies across the region. But during the COVID-19 pandemic, we have added a health sections which was helping us, especially in providing information for the COVID-19 vaccination and testing for the transporters during that period. Because remember, we had challenges for the trucks to move from South Africa as far as Zambia or DRC because of this issue of testing, or sometimes driver will spend almost 2-3 weeks with some of the goods just because they had to repeat the same test like 3-4 times within 3-4 days. So using the CTMS, it's facilitated kindly, it allows the flow of transport and also the flow of goods within the region to be more or less a bit easier during that time. So this was used mainly for that purpose, but we did not for each other. Then there's been also different applications for technology, which speaks to access your normal applications, such as the Binti. Actually, this is an application which has been used for accessibility for HIV services for youth in 6 other countries. We had the HIV guideline applications, which have been also shared within countries. This is also at the beginning level, which is now being shared between Malawi and Lesotho, where healthcare workers can access information between the two countries and also share this information regarding the treatment and also referral of treatment. We have the computer-aided diagnosis used in the TB in the mining sectors, which has been implemented in the 10 countries, supporting also the management of patients. The automated drug distributors, this also was one of the initiatives implemented mainly in South Africa during the COVID-19, but now it's being expanded in other countries such as Namibia. Has been also expanding it for other drugs other than HIV, because initially it was used for the HIV treatment, and telemedicine also, which has got a big project in a country like Zambia, which has been working it to facilitating accessibility to specialized care for the remote populations. So these are the few initiatives that you have, but when it comes to, it's important also to mention that we have several challenges. The main challenge comes in terms of data sharing. What are we supposed to share, and what countries are ready to share? Hence, we need to harmonize different laws, different policies at regional level, and to ensure that we are speaking the same language, and we can also improve the use of technology within the region. So that's the first point for us as the SADC. We need harmonization of law of different laws and regulations, and we also need to look at the issue: how do we address the issue of safety when it comes to the use of AI, of new technology and different platforms? So national, because these are issues of national security. And we all know when it comes to national security, there's no negotiation. You have to abide by the rules. So it's very important. In terms of opportunity also, we have different opportunity. In the region, there's a large, wide accessibility to technology. There are countries where you have 163 phones for 100 people, so it shows that we have accessibility to technology, and we can leverage on that to improve the accessibility to those different tools and initiatives in the region. In terms of, we need also to develop the leadership capacity for technology. We 95, all of us here are born before technology. So this is not our tool. We need to adjust to it. We need to switch or to shift our minds to the technology era and see how we can use it and leverage and make the best use out of that. But we also need to support, as I initially said, the development of different legal, regional, and policies and regulatory framework for the region to facilitate that implementation and also help different countries in the region to work on it. So these are the support that we need besides establishing like an integrated information architecture for interoperability with different systems. On that one, as I said, we've started with the CBRS, which is going to be expanded as a regional health information management system, and having more support on that, building capacities, and having it as a starting point will be a great step. And then we can move forward now to see how we can also work with countries in terms of telemedicine, in terms of accessibility to all those other countries, and leveraging also on the progress, because this does not reflect what is happening in the different countries. Countries have made a lot of progress. We've got different countries which are using all type of technology, AI, the computer that headed diagnosis tools and so forth. So basically, this is my presentation, and thank you for your attention.
Thank you so much, Dr. Lamboli, for sharing updates from Southern Africa. We'll now hear updates from the West Africa Health Organization. Dr. Sani.
Okay, so that's the presentation. The emerging technology in our region. We look at the importance of the emerging technologies. Then what are the specific examples in our region? What are the challenges, opportunities? What are the success stories? What is the support needed, and then the way forward and the conclusion? So, as an overview of WAHO, WAHO is the specialized health agency of the Economic Community of West African States, ECOWAS, that plays a pivotal role in coordinating regional health responses and promoting health integration across West Africa. Really, our mandate is regional integration, because one component of the economic regional integration is the health, because as people moving, disease move with people. So if you don't have a system that can help tackle that issue of disease moving from a country to another one, then you cannot achieve the regional integration. So who was established in 1987, and the mandate is to work to harmonize national health policies, to pool resources, and foster cooperation among member states to address shared health challenges. As a matter of example, for instance, when we have the Ebola crisis in our region, 2014, we established what we call ECOWAS What Element Task Force, where we gathered a professional from the other ECOWAS member states, and they were deployed in the affected countries to help the fight against Ebola. That's one example of what we call pooling resources. One example is the health information, the regional health information that will be shared among member states. That the kind of resource pooling. Who has always, the issue of digital health innovation as one of the elements we are working on, promoting the adoption of telemedicine. As I said, the first strategic plan we developed on telemedicine was in 2018. The digital health information system, indeed we have a regional platform for health information sharing through DHS platform. So all that issue around health information sharing in our region, really, I think we have a system in place, and every year we organize an annual meeting on health information where we convene all the National Health Information System managers and other stakeholders. Yes, we organized the last one in Conakry 2 weeks back. So, from combating infectious diseases to strengthening health systems and promoting universal health coverage, WAHU serves as the primary platform for collective health action in West Africa, demonstrating that regional collaboration and technological advancement are essential for improving health outcomes across the community. So, coming to the importance of emerging technology, yes, I think it has been started by the other people who went on this place before me. So we said that ECOWAS faces critical health challenges, including limited access to medical facilities, shortage of healthcare workers, and underdeveloped digital system. So emerging technologies like mobile health platforms, telemedicine, artificial intelligence, digital health records, they offer promising solutions, but by extending the reach of existing healthcare workers, enabling remote consultations, and improving data-driven decision-making. So we think strategic investment in these technologies, supported by appropriate infrastructure and training, has the potential to transform healthcare delivery across the region. But this requires evidence-based policy frameworks to ensure effective implementation and sustainable impact. So this is the use of the technology in our health system. So mainly this presentation will focus on artificial intelligence, but as I said, the other technology I use in our region. So our main focus is on artificial intelligence. Currently we have a team. The team is developing a tool using artificial intelligence for diagnostic of medical images, image scans, as well as driving risk analysis and mapping for vector-based disease like rabies and malaria. So this we have a team working on it in WAHU. So, the overview is, so this technology can be used, so we can utilize machine learning to interpret medical scans. Of course, this can cover the radiology, the treatment, and so on and so on. And we have some initial results where we look at where the accuracy is high in was the test, and there is a potential for high volume processing with potential to reduce diagnostic time. And in terms of impacts, so this can enhance the early detection of diseases as well as it can provide support to healthcare professionals. So that's what we are developing. And on the right, so we look at the issue of the first is the accuracy, then we have the F1 support that it generates from the computer. We have the issue of precision, and then the issue of what we call a recall. When it comes to vector-based disease risk analysis with artificial intelligence, so currently our team is working on rabies risk mapping. AI models analyze environmental data and that predicts high-risk area. So the outlook is the expansion to malaria, incorporating climatic data, optimize resource allocation, and in terms of benefits, yes, we look at proactive disease surveillance, informed decision making. Okay, so we look at the challenges and opportunities. So in terms of challenges, we have the issue of insufficient computational infrastructure. I think it was raised here. The data issues. So the data issues, the limited high quality data sets, the issue of data privacy concern. If we look at the human resources side, we have shortage of artificial intelligence professionals. We don't have many in the region. And of course, there is a need for training. And we look at the financial constraints. All those technologies need a high initial investment. They have cost. So in terms of opportunities, as we said, it can improve diagnostic, it can support the treatment, it can support the disease prevention and control, early outbreak detection, efficient resources use, and as a regional collaboration, of course, we look at shared learning, harmonized policies. So moving to success stories. So a case study, okay, it's number 2. So rabies risk mapping. So this is what we are doing. with our regional center for disease surveillance and control. So we are using these to identify high-risk zones that will enable targeted policies recommendation to member states. So really, this is to allow us for us to see what are the risk areas where we can have rabies. So we have just to work with the animal and so on and so on. Yes, might be to be more proactive. That's what we are developing as solution. So what are the support we require from EDU, NEPAD, and AFIDEM? First of all, we look at establishing regional policy and regulatory framework, especially the data privacy policies. There is a need for capacity building. As I said, we have shortage of professionals in this area, so we need to build capacity. And the other support is computational resources for scaling up the artificial intelligence solution. So we are referring to the hardware, software, and clouds. And we are referring to the data management system on the issue of cloud resources. So mainly that is our requirements for support from AU, NEPAD, and AFIDEM in this area of artificial intelligence. So if we look at the way forward from our perspective, we look at the strategic planning. We are integrating artificial intelligence into our upcoming health strategy at the regional level, because the health strategies developed so far, they don't have this component of, let's say, emerging technology. So the way forward is really to consider those technology, and it's a new generation of the health strategies. National health strategy, you have to consider that one. Then, of course, we need to engage with member states. So we need to continue to engage with our member state on the benefits of this new technology. Yeah, because if you want might be to implement something that's regional, because our mandate is to harmonize. So how we do it? We develop regional policies by involving all member states, by involving all stakeholders. Then those regional strategies are adopted by the ECOWAS decision-making channels. That means we have the Assembly of First Ministers, but it will move to the ECOWAS Parliament, to the Council of Ministers, and to the head of states. That's the end for a strategy to be adopted. Now, if it's adopted, of course, the next step is to roll out the implementation to support member states to develop the strategic framework and so on and so on. And then, of course, there is a need to continue investing in human capacity for this area. And continuous learning and adaptation. We have maybe to establish some key performance indicators to allow us monitor progress. Here, talking about where we are we going. So that means we need to establish some key performance indicators to allow monitoring progress. And of course, they need to continue improving. So in terms of conclusion, we say that artificial intelligence is transformative and we must adopt to its emergency for the benefit of our population. Collaboration is key because we need to have buy-in even from our member states. They need to collaborate. Yes, at continental level, at regional level, and we must engage with key stakeholders on this journey and cross-pollinate ideas for the African context. Thank you, merci, obrigado.
Thank you so much, Dr. Sami, for sharing from the West African region. We now have about 15 minutes for questions, comments, reflections on what has been shared from the 5 regions. So we're running a little behind schedule, so we could maybe get some 10, 15 minutes from our lunch hour if there are more questions from the team. So just feel free to raise your hand and also indicate whom the question is addressed to, which region. So we'll pick a couple of questions in the interest of time. So I see Dr. Kazim, you would be number 1. Is there another question? There is from Dr. Kinyanjui. That's number 2. My neighbor here is wondering. So there's our colleague here. I think I didn't get your name, but you get a chance to introduce yourself when you ask the question. And then we have Dr. Justina. So those are 4 questions. So we can take those ones. Dr. Adama, number 5. We can take those, and then we have the different colleagues respond to them. As I have the mic, that will hand over to Dr. Kazim. It's really good to see that there's so much going on. And so this conversation is probably coming in for us to see what we can learn from each other, but also for us to think about what difference are these efforts making. Because countries and regions are exploring efforts and they are investing in them, but we also know that we need to show they are making impact for us to increase commitment and the investment. So if any of the colleagues can respond to what difference the efforts you have, the different having, or if you're not tracking the impact, the research institute, there an opportunity for us to partner that difference. Often you need that to engage political leaders, value more money, particularly domestic funding, for driving some of this. That is my first question, not to anyone who wants to reflect on it. I'll hand over to Dr. And then we'll take the other 4 and then
two questions. Start with Sani. Sani, sir, health indicators. Science, economic, data collection. You guys want to play? I'd like health indicators you are collecting, well, some of the frameworks, that, for instance, the slow man science conjunction indicators, which health indicators is also part of. I'd like to know platform health indicators, and then I'd like to know how can you partner with the National Center for Technology Management, since we have the capacity to collect indicators, it will help because ECOPOS, West African Science Technology Policy work, part of what Nasatiama has contributed to. So indicators are expected to serve as input to enable policy implementation. So number two is to stakeholders. So, let's talk about open science and concern to go school, Nigeria, state of the open science. And this discussion went so much how observed country level sensitization and capacity conducted by UNESCO capture in 2022 science, technology, and innovation policy. Able to capture open science for country level, how science, which concern specific requirements of country. Now, one concern I have about this, how we manage issues. Sharing this open source as regards, of course, the security, that's some of intellectuality, that's some element of culture, African culture, especially health issues that Africans don't even seek, aware that I'm sick. Yet we now want to open science. Thank you.
Thank you. I'd like to start by thanking the and the first question at EAC, Dr. Fortunate. I think I had started the conversation with Dr. Fortunate outside during about the process. They talked about how he talked about sharing of members, sharing of between. That's us, especially in a time. I can agree with that, having that kind of sharing state. What are some of the what are some of those share with other that they my second all the that present and governance. I think much in that meant that something came out that some policies are in place. Tackle personally the just asked. Mine is, how do we govern, how do we manage possible harmful, example, medical bots, as doctor bots. So, of course, there are elements, chances that some of these guys, particularly diagnosis of medical conditions done online, or treatment offered online, or advice offered online, there can be mistakes. So how do we regulate some of those harmful effects as have been evidenced in other parts of the world? Thank you.
Thank you. Let me start again. My name is Barack Odwor. I'm a journalist in Kenya. I work for the Kenyan Foreign Policy and the People Daily. My question was on almost all the regional economic communities. Sometimes because we know, because of political reasons, some countries get suspended from this bloc. And in terms of the plans you've had for the health plans you are having, I would want to know how they get affected in terms of implementations. For instance, in economic community of West African states, ECOWAS, we know that there are some member states that are affected, and it could be in SADC also. How are these states that are having their membership in dispute affected in terms of implementation of such strategies?
Thank you very much. So we have Dr. Justina and then Dr. Adan.
Okay, thank you, Dr. Rose. I'd like to join the colleagues in thank you, the presenters, for such brilliant presentations. As the presentations were going on and looking at the work that has been done and continues, one word that kept coming to mind was sustainability, because it came through that, some of the brilliant work being done is actually being sponsored by development partners in the north. So the question then is sustainability, the reps, how are we ensuring that, the work that is being done is going to be sustained in the long term? I know Dr. Rose touched on it a bit. So just to reiterate that and see if we can have a discussion on that. Because there was a mention on domestic resource mobilization, which is really critical, but that did not come through when the presenters talked about the next steps and all that. So I'd really like to know. Okay, thank you.
Thanks, Dr. Adama. And then Mr. Second.
Okay, thank you very much, Dr. Rose. Thanks to all the presenters. I really appreciate the high level of information provided. I have some question for my neighbor for the SADC presentation. I know that in SADC we have several language speak. In addition to English, you have some countries speak, I think, Spanish or Portuguese, Mozambique and Angola. How you overcome this barrier language with this kind of countries for sharing the health information? The second question is regarding the harmonization you are going to put in place among the members of SADC. I know that in many African countries, the health information system need to be improved because, by example, the private sectors, in many countries, the private sectors do not report data to the health information system. And this is a gap we really need to be filled if we need to have all information system for the country. How you plan to solve this kind of issue? I know that in Burkina Faso, in some big city like capital city, where you have many of the health facilities are from private sectors, the issue is the reporting health information to the national health system. How you plan to manage this kind of, I don't know if it's the same issue here, but in our region is something happened. My next comment is regarding the work done by AFIDEP on the African country. I attended, I think 2 or 3 months ago, a similar meeting in Malawi, and now we are in Kenya. I don't want like to know if there is something planned for the Francophone country, because this is really some important dialogue. We increase the awareness of what is on the platform, what is on the pipeline, and maybe could help some organization like WAU, some countries, in some leader from Minister of Health or some policymaker to take into account this kind of health technology when drafting the strategic plan. So it's very important to multiply this kind of dialogue, not only in English-speaking country, but also highlight, have an overview for Francophone, a view for Francophone countries. My last comment is regarding the interoperability between the different systems in place. We have a national health information system, and sometimes when the partners come, they develop another system, which sometimes is difficult to link with our national system. So for me, this address an issue regarding the governance and the leadership. We need to increase the leadership in our country to have guidance, documentation for all partners who want to come and implement another platform for data collection, electronic data collection, to be able to link, to have a kind of mandatory things to oblige the partner to link. Otherwise, if a partner leave the country, leave with all the information, and you cannot retrieve this information again. Thank you very much.
Thank you for the degree giving causing some effect. We need to congratulate the regional economic communities, and we are observing that as things are moving on, it's very difficult to work in silo. Science, technology, and innovation, as we're always preaching, are cross-cutting, are not panacea, but they are enablers in the current knowledge-based innovation-led economy. We have a strategy on the continent to help us to harmonize our data called SASHA. And then we are seeing something very great in the EAC region, DIDATI, expert working group on digital health, data, technology, and innovation. And we understand from that, we were not aware on our side at AUD Nepal, because the role I'm playing is to coordinate the continental program on the tracking of the target we have in terms of research and also innovation for competitiveness, known as the African Science, Technology, and Innovation Indicators Program. So I just need to find out if there is a possibility for us to start again under this platform we are handling, the Dota Zulu. I think this issue of data is very important. At the SADC level, we have the SADC reference group on science, technology, and innovation. It's said that we don't have a representative from ECAS. We have Dr. Blaise Osene, but we also understand some of our RECs are going through very difficult moment in terms of budget. It's not that Africa is broke. This is where we have to prioritize matter, because STI is a weakest baby, and the other portfolio are well funded. So I don't know, through this process, I think we have HDRAS, we have AFIDEP, we have other think tank the venue. Let us think about the way forward. The reason why I'm saying that, while congratulating the RECs, and we have to empower them as well, a collective responsibility for us to support countries, is because we have now what we call the international decade on science, the international decade for science sustainable development. And if that only have 2 pages, they are only focusing on data. How we need to use data, inform our decision makers, never a discrimination between basic research and applied experiential development. And this discussion is also flagging that we need to support some of our RECs, at least Texas, than having a STI component handling data in isolation to start putting together. Because now the revelation is coming from this is that for us to speed up the health tech aspect, we need to start also addressing issues related to data holistically. Even though STI is having a component of health data, but let us go to other portfolios, come up with something well harmonized as we are preparing the implementation plan of CISA 2025. This is something we can have on the table with all the distinguished representatives in the venue to discuss and to come up with some more recommendations by the end of this. Thank you very much.
Earlier, people, what are they doing? Governments make that data. There are many questions. I was trying to take notes. I probably didn't pick all of them, but I know that some of the questions are for all the RECs, so I would like to request if we can all reflect on them. There is a question on the difference this is making, reflections from the different RECs. There's a question on sustainability. Again, this can be spoken to by all the RECs. Trying to see if there's another question that needs to be heard. The question of countries that have challenges, yeah, the question from the journalist, countries that may have challenges, the different regions, how is implementation going on at the regional level? Of course, there's a question to AFIDEP. Yeah, and then there are specific questions to ESTECO and EAC, and there is one to SADC. I think there was there any, I think, yeah, there were a couple to WAHO, particularly from, were they? Am I dreaming? Were there any questions for WAHO? No. Yes, because I can see WAHO, but I didn't write the question. So there are questions to WAHO. So I think I would like to request from the regions, if you can respond to the specific questions to you, but also if you are able to reflect to any of the broader questions, if at all. Some of them are also conversions will continue today and the next day because they're so critical. So we'll start the usual. We'll start with, I'm looking at the alphabet. We'll start with the STECO, then ESC. And then IGAD, SADC.
Yeah.
With West Africa. And the next time we're having this meeting, because the meetings you're having are regional meetings. I think we kind of had them. We had one in SADC 2 months ago. You're having this in East Africa. So the next one must happen in West Africa. And I'm looking at Dr. Sani here, who will ensure that he hosts that meeting for that to happen in one of the
in a Francophone
West African
yes,
country. Now it's
yes,
being very specific.
Yes, that has to be specific.
Okay. Dr. Fortunate, you want to take it away?
Yeah, thank you very much. Specifically, I had 3 questions. One was on how we are managing open data clouds for health data. Open science is now open science and science diplomacy now is now the way to go, because sharing data has been of essence to STI. Dr. Seke will tell you that currently we are in the process of developing the STI indicator for all Africa. It has not been easy. Since now we have the infrastructure and we need now to go to the STI. Coordinate together. Once we are developing data, we need to coordinate together. 2 is my data secure with you? That's the most important. Is the data secure with you? And also, is the data collected from one partner state? Can it be linked with another partner state? So we need to also to look at the interoperability of our data systems in place. Is the data secure? And secondly, do I trust you with my data? So the mutual agreements sharing data, the protocols have to be there, the frameworks have to be there in terms of data protection and governance on data sharing. And once you look at the open data, we have what we call open data. Open data is basically free access. But there is a country data which I myself cannot publish. I have to get the statistic. Framework. And this is approved by the sector councils and the council of ministers. That means each partner state asserts that this is the procedures, this is the agreement, and this is the way we need to share our data. Privacy, access, all that. For the STI indicators, we have also developed a framework only for the STI indicators data from partner states. And we are working with the National Councils of Science and Technology, data collection in each partner state. And these are frameworks. Somebody has to implement them. Some of these frameworks, once you don't have an implementation plan, actually costed the implementation plan and funded. Some of these frameworks, you'll find them on the shelves. Because whose responsibility? So these frameworks name the responsibilities, the roles, and the party for each and every data to be collected. And where is it stored? Is it stored on a central place? Is the access in the cloud accessible to all, or only have to have credentials to access the info? So we have a lot of challenges in the data sharing, but those ones are linked to privacy, data privacy concerns, infrastructure gaps. Some of the, as you know, some of our partner sets are at different stages of development of this infrastructure. So how do you link somebody who has the infrastructure and somebody who doesn't have? When you talk of STI policies in the region, some countries in EAC have STI policies. We are now trying to help them develop theirs so that we are at the regional level, at the same level. The last one was on data governance and protection. That one I've hinted on it, but data, as I said, is very sensitive, and what we have in our data governance and protection, we have data privacy and security concerns. We have those which are interoperability issues, infrastructure, and legal frameworks, and also lack of trust among stakeholders. So we have had to have partner states sign agreements. And which data? Because once I'm having, it's not all data, it has to be specific. The agreement has to be specific. We say partner states are going to share health data. But which health data? Which is across? When during the COVID, we established hubs and centers at each border post. And these border posts are still collecting data. Look at Ebola and Marburg, which happened. Data is being collected at all crosses of borders in the EAC. Rwanda, between Rwanda and Congo, between Rwanda and Burundi, Uganda and Rwanda, between Rwanda and Kenya, Uganda and Kenya, all this information is being collected. And in so doing, who houses this data? This data has to be housed by the EAC. So is the movement of goods and services and the people in the region. So these challenges are many, and we talk one by one through dialogue, stakeholders involvement. I think we can put them on lunch if you need more information, but as of now, that's what I think. As for the journalists, we have not suspended any country. Yeah, sustainability. Obviously, sustainability moves with stakeholders' involvement, with the funding, and the ownership. Because once a project comes, it is funded by a development partner. Once it goes, what happens? If you have not built the capacity, forget about that project. That's one thing. Are the partner states putting in funding or in their national budgets? Not at the regional level, in their national budgets, they should now put money in the national budgets or Ministry of Health. Apart from that, are the facilities in the infrastructure? If you have no infrastructure during the project and you are not planning to have an exit in a building of more infrastructure, then the whole project. So sustainability, ownership, all that we leave project once the thank you very much.
Right, Dr. See, Prof. Bali has a comment, so Prof, go ahead and then we come back to the other rates.
Yeah, I just want to, I think, this other question about the countries being suspended and interview. Usually, the socio-economic programs are not affected by countries being suspended. They still continue. Burkina Faso is suspended at the EU. I think even maybe at ECOWAS. The socio-economic programs are still taking place. UNEP still does programs in Burkina Faso. So these health, and other programs, they don't get affected. Technical programs don't get affected. These are the political aspects that are affected. And I think this cuts across all the countries. I don't think any program, it's not like today if Kenya would be suspended out of EAC, that would be the end of programs in Kenya. No, the programs will continue. Kenyans will still be able to work for the EAC and what have you. So really, I think I just thought that I should answer this one. That, there's a lot that involved in suspensions, but there are critical things that are not affected. The political things, so when they say you can't have suspended, some of the changes are, let's say for instance, when they are for these summits, the head of state may not be allowed to speak. Okay, so it's soft things like those political things, but not things like health and whatever. Thank you.
Thank you for clarifying that. Dr. Otip, did you say anything or please go ahead?
Yeah, just there was a question about how do we handle the aspect of information sharing when we're having pandemics. That's actually a very important question because we always have that challenge of pandemics. So one of the things, like my colleague said, in relation to data sharing is the aspect of looking at the issue of safeguarding data privacy. So for pandemics, usually what we do at the East African community, we try to, first of all, to use the structures within the different partner states. Like most of, not all the partner states now have these public health emergency response centers. So you engage, because through there you'll be able to share information. Then also, whenever we have pandemics, we always have cross-border teams. So these teams always meet at a specific time, and then it's very easy to access data. But also the advantage we have that some of the data in relation to pandemics doesn't touch too much in terms of privacy, because most times you just end up speaking about numbers, you don't identify the individuals. So somebody will just tell you that monkeypox, Rwanda, there are 300 cases identified, 6 people have died, but you don't go into the details, including on aspects of privacy and confidentiality. But also within pandemics, for well-known reasons, usually when there is a pandemic in terms of funding, we find that there is a very great, normally robust response in terms of resources from the partners. Of course, the reason is that pandemics can affect everybody and they can block the world. So usually when we have a pandemic, it's very easy for resources to flow in to handle the pandemic. And that's an advantage. So you'll notice that when we look at these emerging technologies, there are some aspects where you know that something is relevant, but you operate according to the interests of the person who's giving, and which is quite unfortunate. But I think for just going into the aspect of sustainability across the regs, if each reg could give data in terms of who funds some of the initiatives they are working on in terms of this emerging technology, probably would end up with some statistics which is quite embarrassing, maybe up to 100% funding by partners. And maybe that could help us to make a statement and at the appropriate forum to inform the decision makers that we need to take responsibility and fund some of the initiatives so that it can be able to help our people. Because, for example, the years way back in 1970, for the breakup, it was only 3 countries. But up to, people say that up to almost 100% of the programs were funded by the partner states. So for some reason, you find that the priorities are upside down. You find that even the countries don't default in terms of their commitments to funding. So you find almost all the activities are funded by partners. But as a technical person, you find that most times as you plan to implement the activity, the partner will sway you the area which they focus on. You can't just simply tell them that this is the best thing I think is the best for us. That's the challenge experience. Thank you.
Thank you, Tim, for the sharing. Harry, do you have anything to say relating to the questions? You didn't have a specific question for you, but maybe if you want to comment on it.
Thank you. I think I had a question of my own directed to Dr. Fortunate. I wanted to hear him share more. I think he shared about integrating the electronic health management information system that they worked on in ESC, and it was an area of interest to learn how they approached that and the lessons they learned around there. In terms of sustainability, I think most of the points have been raised. Areas of preparedness and response. So that has informed our new program, and we are moving towards also setting up a center of excellency in pandemic preparedness and response. Yes, so that's for sustainability, supporting. So I think we'll hear from Sadak, then from Maho, and come back to the last one to when we head off for lunch. So,
yeah, thank you. I think the questions regarding SADC were first, for the language, I believe it's the same like the African Union. All documents are translated in all the official languages, and all meetings are mandatory, translated also in all the languages. That applies to all the organizations here. For harmonizations of policies and also in terms of, especially the private sectors, that's a challenge that you find in all countries, member states, even the developed world. It's always difficult to have the private sector aligned in terms of reporting and so on, unless for some few diseases like TB, HIV, there's been a lot of improvements since they've been monitored by the law, and it's easy to collect data. But when it comes to other health data, it's still a challenge, which needs also now to be looked into it to see how we can improve the regulations, the laws to make them mandatory, also have the private sectors to report. For the issue of sustainability, I believe we all have the same challenge when it comes to sustainability. How do we convince the decision makers to fund those different new projects, new initiatives, and so forth? And we all know that, I'm sure most of us will be seeing, especially when you go through the discussion on sustainability, the health financing dialogues, the first approach or the first assumptions for the principles is to consider that the health sector is one of the best funded by the partners, so we should be focusing on something, especially education, social issues, and so forth. That's the partner supporting the health sectors. That's what leads us to, I think, everything being led by the partners today and deciding on what are the priorities. However, it's also an opportunity for us as REG to make sure that those issues are brought forth to the level of the head of state to ensure that they are aware of those issues and also decide now to fund them in terms of sustainability. We have partners funding them today. In the next 4 or 5 years, next partner will tell you that it's no longer part of the priorities. They need to move to the next priority coming, and with those, all the efforts, the achievement will just fall into pieces, and they want this sustainability. So maybe we can try also to see how we put them in the end. Across health sectors, we cannot move without technology. We need technology to improve the healthcare service deliveries, and also especially in management of data and information. So it's very important for us to look into that and make increase advocacy and ensure that the decision makers actually are on board. I think those are the 3 questions that we had. Besides that, the last question, which was addressed to everybody, is the one on emerging technology. What is the difference that they're making? I think in terms of difference, it's very clear. It's global, at regional level, or even at national level. It helps us especially to make quick decision making. So we've seen it with different pandemics and epidemics, outbreaks that we have. We collect this information. Sometimes you have information through social medias, WhatsApp, Facebook, providing those informations and raising the alert at the national level to tell you that there's an issue, something is going on in this region, so you need to invest. So I think it's making a difference in terms of the speed of it. How do we react, and also to make more informed decisions in that sense. But also, sensitization has become so easy, unlike in the years we can share information with larger groups at a very cost-effective manner, but also on the back side of it, it may also go wrong with the issue of the years and so forth. So the difference just depends on how we manage, how those tools for the benefit of majority, And we also need to ring fence or maybe safeguard all those issues with very strategic policies and laws and rules which are in place, which help us actually to avoid some of the challenges. Thank you.
So I think the question to who was raised by around indicators, around collaboration with your research institution. So before moving to it, let me clarify the issue of research in the ECOWAS framework. So ECOWAS, we have a directorate for science and technology that is part of ECOWAS Commission under Commissioner for Human Capital Development and Social Affairs. That's the one dealing science and technology. Now, we as a West African Health Organization are working on health research. So, and our business is first of all to work with members to find out if they have all the framework for research, have the document, they have the structure or all what is needed to organize health research. For example, in some countries, as the Ministry of Health, you have just a unit. In others, maybe you have a director, health research, okay? Then move on to support capacity building on the issue of ethics committee, because you can't do research if you don't have committee that providing the go ahead for the research project to be implemented. So work with member states around all those kind of issues. Now the other issue is, so we have the various research centers and we have to put them in a network. So when you have a researcher working on malaria in the region, so we have to make sure that all of them are communicating. Okay, so all the research institutions, the researchers, so and we support the establishment of what we call even Africa Journal for Health Research. There is a secretariat for this one. But we support it. Function. Of course, we organize dialogue on research. Okay. Quite every 2 years we have to have a regional dialogue to talk on. Now, if we have specific project research, so connection with the research centers, the countries might be to provide fund for some specific research. Okay? So that's what we are doing. Of course, even we were providing scholarship for training of research, everything around getting the instruments for research in the, that's what we are doing in terms of research. So normally all institutions doing the research was region. They are part of this framework. So now I move on to indicators. So you know all this technology we are talking, they are just tools. Health. The very prominent indicators, they are the health indicators. So we as a regional body have to get let's the data, what is that, from member states. So, first of all, we have to agree upon what kind of indicator are we going to establish to collect data for. So, we organize a series of quantitation, regional quantitation, and at the end of the day, we have a set of health indicators that we agreed on. And the system around the district health information tools, so it was established in a way to collect the indicators. Because in our region, we have the issue of interoperability, but between countries and regional level, really we have I can't say we solve this problem because we have automated data transfer from the country system to the regional one. Okay. We have only 2 countries not in the system, but we're working to get them on board. However, you have the issue of interoperability within countries, because in a country you have many systems. That's where we have the issue of interoperability. Okay. So that's how we work around health indicators, how we collect data, and so on and so on. So just I want to touch on the issue of governance. You know, if you are a regional body, you are supposed to get data from member states. So unless you have a platform, a kind of framework that assure countries to share data, but how the data is stored and so on and so on, how it will be used. So that's the issue of data governance. So you have one if you want people to provide you data. But even when you have this one, it's not easy because the issue of data, you know, it's a very sensitive issue. We have an epidemic in the country. It's very sensitive. So that's the issue of governance. So if you don't have this framework, it's difficult to manage at the regional level. Okay, that's what I can say on the issue of sustainability. I think that's why we have this ILM declaration, and I think we have to work hard through getting the declaration implemented to get more resources for health, because that's the only way I think we can sustain what we are doing. So I think that's issue I want to comment on, if I forget something. But I have an issue to support my brother from Burkina. Yes, because there is our people from Yes. So, Maria, you are here. Yes, because this kind of forum, it's a platform for us to interact between the AU and the REX. So we have maybe to bring some issues. Whenever I attend a meeting, I used to raise it. Even the documents you develop, mainly you develop them in English. You don't have input from the other part of the country. So I think it's something you have to correct. I can tell you, we work on the financing tools. Ask at least to provide the version in the other languages. It was not possible. And the thing is, you want at the ministerial meeting other countries to report on the tools. Or those tools are not even the language. Want a UNIPA to consider this issue. And we look at it. Every time we're invited to come in this region, yes, we need to continue to organize meeting in the region. And I said not Ghana, but it's not I'm against my sister. No, me, I'm equals. I know what I'm talking about. I want her to come to enjoy Senegalese. Just again, but why not? Huh? Not only be having Banku, no, Banku, no. I agree on that. Or romantic. So really, this one just is we want to call you. Okay, so it's an issue you have to, but it's not just a complaint but have to consider it, please. Okay, so.
Dr. Let me answer it on their behalf. Okay, let me answer it on their behalf. I don't think anything that stops a document from right language that it's aimed for. Went on the edge, never the website. I don't know how, but I know, yes, that I can find documents in French, and if there's need for Portuguese, if it's studying the Portuguese, about the meeting of today, the interpreters were sitting at the back there because they thought that they're going to be that be French. That may need French interpretation, but yeah, and what have you. So, what you would do is don't hesitate, ask them and say, this meeting that you organize, in which languages they will translate them for you. It's a right. Sometimes say it's a right. You can ask. If you invite Sadiq can say, ask documents in the languages, French, Portuguese, and English. And you can even say that if you don't have the documents in this language, you don't have this meeting. You have got both rights. So what I'm saying is that if you maybe there have been cases where people have not done that, it's just a matter of relaxing, but otherwise it's a policy that I have the language with the people. In fact, if you are doing something in North Africa, you are even supposed to have Arabic, and they pay for those translations. That's why if you look at the jobs that they advertise out of anybody, they will be there in English, French, Arabic, and even Portuguese. So just ask.
So we are an African family here. I'm talking from experience. Okay, I know the rule. Okay, me too, I'm in a regional economy. We know if we have the meeting, we have to translate the document in the few languages of equals, okay? But from experience, I know maybe it's not just something neglect or something, but we experience this situation, okay? But okay, there's no need for me to say some example. But what I'm saying, just we are around what we are doing. It's normal to have some weaknesses and so on and so on. Okay? So if we are raising this issue, I think it's in a good mood. No, so what I'm saying, I'm talking about experience. Okay, what we experienced very recently. Okay, is so.
I think the issue about documents translation is routine, that it happens, but is asking some of these physically the Francophone region.
That's one. But there was this issue of, well, there are two issues there.
Oh, right.
There was the issue of the documents, I think what might have happened, I don't know about you, Dr. Sani, but what might have happened that, you know, you are getting these documents, at most probably on ALM, that basically they have been in one language. But if you look at the meetings that have been held, they say MRIH, AMA, and what have you, but they come in in those languages. So what I'm trying to say here that, you know, as humans, sometimes we tend to relax. Legally, the post demands that. You know, we used to have, they used to, when I was going for ADB, there used to be Dr. Mayaki as the CEO of ADB. So he insisted, there's no way we could send a letter to a French-speaking country in English. Say, no, you can't do this. So sometimes we relax.
Non, c'est très clair. Hein. J'ai dit, vos cas, je peux parler en français. Oui, oui.
This way headsets, I'll speak French. There are things that we are used to. There are places where meetings are held because it's easy to go there because you don't need visas. That has nothing to do with the institutions. You cannot say that we will not hold a meeting. It's difficult to get a visa in a certain country. So I hope you understand this, but there are things that we need to correct, and this is the spirit that I'm talking about, the continental spirit. Our role is just to raise these issues we are complaining. So anything that you may miss, just simply remind you. Thank you.
Sorry, I stepped out, but I'm told that all the questions responded to. One for Iseko, which we have requested that you talk over lunch, because we have eaten like 40 minutes into our lunch hour, and I'm worried that we might miss our lunch. So we need to break for lunch, and any other questions we can deal with them over lunch. We'll break right away, and the media team is outside. They want to take a photograph. I don't know if it's here or outside. Is it here? So he will lead us to where we take the group photograph. Then we go for lunch. Lunch is served. Okay, lunch is served straight ahead. There's a nice restaurant at the end of this corridor. So once we do the photograph, we head there for lunch, and then we reconvene. I'm told the session immediately after lunch may be a short one. So don't worry so much about time. Don't get blood pressure because we're running behind schedule. We should be able to catch up and finish for today. Thank you so much. Maria, is there anything you want to say? Okay, so we head for the photograph and then for lunch. Thank you.
Inshallah.
health and STI. Unfortunately, we only have one person from STI, so we only have one presentation, and then we'll go into the next session of the agenda. So, Dr. Fortunate. Karibu. Oh, sorry, Rose had something to say. I forgot. As Dr. Fortunate comes on, we had some unfinished agenda in the morning session that I was moderating. So please just bear with me. Just to note that, Dr. Sani, you raised the issue of having the next meeting in West African country of Francophone, but also addressing the language issues so that we ensure that for all the meetings we're having, we are planning for proper translation both ways for the different languages. So just note that we take note of that, and we will be ensuring that our next dialogue that happens takes on board those suggestions. Thank you so much. Back to you.
Thank you. I'll be very fast because we had exhausted some of these applications in the STI, and we have been working with in some areas with the NEPAD, especially on the STI indicator database, electronic database, and also streamlining the data collection at the regional level. So I will only talk about what we are doing in terms of science, technology, and innovation in the region, as mandated by the as mandated by the summit that established ESTECO in 2017, and okay, yeah. So maybe you can keep doing that. Yeah, okay. So we had already talked about our mandate as for development and management of application of STI in the region. Next slide. So these are our priorities as for the East African community. Strategic priorities: one is to develop evidence-based regional science and technology and innovation policies. The second is to promote science, technology, knowledge, and innovation. And the third is to develop applications of STI for economic development. And then we have enhancing collaboration and partnership in the STI community, and then strengthening institutional framework for effective and efficient governance operation. Next. STEM strategy. STEM is the science, technology, engineering, and mathematics strategy, and it is gender responsive. We developed a gender responsive STEM strategy for the ESC, and then from one partner state to another without first going to be verified in terms of qualification. And the boards of these engineers in different partner states have signed a mutual agreement for the engineers to move across, and they are under this STEM program. Then we also have regional collaborative programs, which are basically programs that partnership developed to support scientific research. So we support collaborative linkages, especially by facilitating agreements in cooperation in STI, also in facilitating the regional centers of excellence in STI, and the support establishment of networks of R&D institutions, where we have now the regional technical working group on R&D institutions, which are formed from the academia, the private sector, and the industry. And then lastly, on this strategic objective, we have established East African Journal of Science and Technology and Innovation, and now we are publishing. We are now on the 9th issue, and it has already been indexed by Corpus and the other indexing organs in institutions in the world. And we are looking forward to covering the whole of Africa. We are now receiving articles from academia and research from EAC, but we are going now to open it up to have all Africa to submit their journals in science, technology, and innovation. Next. Under the same knowledge and innovation, we are now regionally supporting commercialization of innovation and technology by establishing conducive environment for technology innovation and also uptake of innovation centers and funding. And here we have regional centers of excellence for innovations, and we have also established a regional technology and development fund. This is a fund that is going to fund research and innovation in the EAC region through joint collaborative research grants for only innovation in different sectors. And we have also provided support for innovative technology solutions in the health sector, where we have developed e-health and telemedicine framework to support this particular activity. And the initiative to enhance community innovation capacity, where we are funding youth innovations in different sectors for innovations that are demand-driven by the citizens. And then we have also established training on entrepreneurship training for postgraduate and faculty for enhanced creativity and job creation. And obviously, the training on scientific manuscript paper writing and grant proposal writing to feed our journal. We found out that most of the postgraduate and graduate who are doing their masters and PhD do a research at the end of the course, and they need to publish the results. So that's the reason why we established the journal. We have also fostered STI knowledge dissemination through conferences and forums. We have the regional STI conference, which is biennial, Youth Innovation Forum, which is annually, regional e-health and telemedicine conference, which is biennial, and then regional innovation led by economy conference. And last 2 weeks ago, we had the Global Bioeconomy Summit here in Nairobi, where the world was deliberating on the innovation led by economy in the region. And it was a successful conference. Next. Application. In terms of application, we are increasing value addition in agriculture by harnessing and disseminating technological solutions. And these technology solutions, we are supporting value addition. We are also coordinating regional STI initiatives in agriculture value addition, and also disseminating innovative and appropriate technology solutions for approaches for improved storage and agro-processing. As you know, those who come from the agriculture side, post-harvest losses are many. It's a lot, and that's what is basically letting our farmers down. So we have improved on how appropriate technology solutions we can have and approaches for improved storage and agro-processing. Then promotion of technology solutions in energy and environment. Basically, we are supporting climate change adaptation tools for in the sectors of energy and environment. So we are promoting renewable energy technology solutions We are developing portfolio technology tools and adaptation for climate change. Among key priority areas, that is environment and energy. We are also enhancing collaborative research on climate change research and development, and also supporting innovators and entrepreneurs to develop their product until the commercialization stage. Next. Under the regional cooperation, we are enhancing innovative biotechnology solutions. Currently we are developing, starting next month, the ESC regional biotechnology and biosafety strategy to look at how we can enhance the innovative biotechnology solutions, especially in a biotechnology innovation program, and support community centers of excellence in biotechnology, and then developing these guidelines. Because these biotechnologies, some of them are not, they can be detrimental if you don't control them. So we have to have a regional biosafety guidelines on how to control these biotechnologies. In your countries, you have seen a politician debating about the GMOs and the biotechnology. This is where the reason why we want to have harmonized policies on biotechnology and biosafety. And if the Council of Ministers approve that technology, then all partner states have to implement that strategy. Then under the regional support, export-oriented industry development by trade to facilitate access to institutions and technologies. We have a network of technology transfer institutions, and we are going to establish a center of excellence. We are now currently doing the assessment for which institutions should have this center. We are also promoting linkages between research institution, academia, industry, and business. And we have, normally we have ISTECO and the University Council of East Africa have a biennial conference on public-private partnership forum. And it brings the academia, brings the industry, brings the researchers, and the business people private to talk about how to commercialize products and services from R&D to the communities. Then supported by technology-enabled trade, basically to increase the levels of national, regional, and international trade and standards and testing, and then supporting also advancing technology transfer and commercialization. We have a lot of technologies that have been done in China, Malaysia, Kenya, but they are not in some of these partner states. So we facilitate the transfer of this technology and commercialize in different parts of the region. And this, we are now developing what we call innovation and technology transfer strategy to help us realize this activity. Next. Development of regional ICT capacity in terms of promotion of effective, productive, and social sectors. So we have a regional women and youth inclusive ICT program, which we are running, and the feeds into the Youth Innovation Forum, where awards are being done to best innovators that have innovated on demand-driven innovations that can solve a challenge in the region. And then also supporting innovations in and using ICT at the regional level, including dissemination of ICT to rural communities. We have now a student from Nelson Mandela in Rwanda who has developed now an app for climate information dissemination to farmers. When to plant, when to harvest, when a rain is coming, what are the temperature. So all the climate information system, a farmer have access. And this information does not only stop there, it also gives advisory services in terms of prices, how much is a kilogram now of maize, how much is a kilogram of bean, so that they are not cheated on, because there are many brokers for these goods. So it is now an innovation that we are supporting, and we want to have it for all of the eastern partner states. And also we are utilizing ICT tools to drive economic growth by enhancing partnership between technologists, entrepreneurs, and researchers. And actually in R&D, there is something which we have realized that we have good products from research and development in our research institutions. But they end there, they not go out. So we have picked those ones which we can commercialize and take out to the communities that they can help our people. So we have in the Kenya, we have Kiridi, we have Uganda, we have Uganda Industrial Research Institute. In Tanzania, we have Tanzania Research Organization. In Rwanda, we have CNN. In Rwanda, in Burundi, we have all those have come up into a network, and whatever they are producing for their countries, we are transferring them to other partners because they are good innovations that need to be commercialized. Next. This is the last slide. This is our stake of fundamental commitments. One is to enhance collaboration and partnership to enable sustainable funding and enhancing partnership in the STI communities through funding mechanisms of STI initiatives and also establishing mechanisms for outreach, partnership, and collaboration. And then the last one is strengthen a stake institutional framework for effective and efficient governance and operation, where we are enhancing institutional capacity in STI development, knowledge management, and communication, and also improving stakeholders' communication and visibility. And then lastly, acquisition and employment of appropriate technologies for increased efficiency. I think that's the end. Thank you.
Thank you very much, Dr. Fortunate, for that very, very detailed presentation. And I can see that the ESC is doing quite a lot in terms of advancing STI to improve the region. We'll now go into questions, and I have the first question. Any other questions? So that okay. Okay, so I'm seeing two hands. Have I missed out anyone? Oh, Mr. Sani, those are three. Anyone else? Professor Mbali, 4. Dr. Elia, 5. There are 5, right? Okay, so I'll ask the first question and then I'll give the rest. Given the very many programs, I can see that you presented very many things that are happening. One of the issues that we usually have is continuation or implementation of the programs. How is the ESC ensuring that there's sustainability for these programs? Because we don't want to, let me say, you said you had a program on, I think, women and youth inclusion in ICT. So most of our programs are donor funded. What is the ESC trying to do to ensure that there's sustainability of these programs without also costing the taxpayer? Yes.
Okay, thank you. Sustainability is a big issue because, as you are aware, for East African community, most of the funding is from partner states. We have partner states contribution every year, and this some of the other programs are also funded by development partners. But as I told you from the beginning, we coordinate and support. The implementation is the Uganda, is the Kenya, is the Tanzania National Council of Science and Technology. And they have a national budget every year. All of these activities, once we have conceptualized them, we start implementation with the national governments. So the sustainability, the national governments always implement. For us, we coordinate and support. We don't implement. We only implement those that are what we call soft ones. If the conference, we can manage the conference. But if it is the youth and innovation, youth and the women innovation, that one is done by the Ministry of ICT, Ministry of STI, and the National Council of Science and Technology at each partner state. So that is the sustainability we have. And for the development partners projects, we engage in capacity building for our citizens, for our institutions, so that once the project ends, the capacity is there, the funding might be less, but the capacity to continue implementation is there. And if you look at some of the research institutions that we are working with, they already have the experts that we train, they already have the infrastructure to implement these projects. So that's the sustainability we have. Thank you.
Now we'll go to Dr. Basiliana.
And about the student from the Nelson Mandela in Rwanda who managed to develop a demand driven kind of innovation to farmers. So my question is, there are so many of that students in the region, and what is the role of the REC in protecting, the intellectual property rights and patenting, which had been silent, and also this innovation you will be found have been taken by other continent and the like. Thank you.
Thank you for that good question. And as I said, in our first priority, we developed an intellectual property policy. Intellectual property policy, we have worked with Alipo and also the national registrar institutions like KPC in Kenya. Then we have Uganda Registration Authority, Bureau of Registration. We are working with those ones to make sure that any innovation is registered. We first start with the registration and we help them to register, because that's why these institutions are there. Because we know these innovations, some of them are being stolen from these innovators. And some of them, you know them, which are even now at the highest level of profitability. Now, we don't end there. We train. During, you saw the entrepreneurship skills training. It includes IP, patent, copyright, to enforce the IP regimes. So we don't only help them to register, we also facilitate them in the capacity building so that they know what they are supposed to do. We might not help them to do, but we do capacity building for patenting their innovations. Now, we have also the joint collaborative research grants, where people have innovated. One is from Kenya, another one from Uganda, another one from Burundi. They are doing one product. They are developing a product and services. How will they sell this product in Kenya at the same time in Uganda, at the same time in Burundi? So we have linked them to these, they are partner state IP offices. And these IP offices have generated and allowed them to register and transfer free of these products from one partner state to another. We have now in Burundi, mosquito repellent. It's like erosion. It's just erosion from essential oils. We had a problem. After realizing that they have had a product, they said, now, how do I transfer this product to Uganda? Because it's not registered in Uganda. So we had to go to Alipo, because it's the African Regional Intellectual Property Organization that we have. They guided us on how to do that. And now the researcher in Uganda is able to sell the same insect repellent, mosquito repellent, and also the one of Kenya and the one of Burundi. So these things happen, and we are looking at the solutions for such. So we are in capacity building for IP for our innovators. Thank you.
Very much. I think we'll now have a question from Dr. Justina.
Thank you very much, Dr. Fortunate, for such a comprehensive presentation. You mentioned something that's really close to my heart, and that's the post-harvest loss, that you do have a program on that. So just wondering if you can provide more details as to what are some of the examples that you have on ground. Thank you.
Okay. Thank you. We have done an assessment on technology solutions for post-harvesting. And in each partner state, we chose 3. And depending on the agricultural crop that is being done. So we looked at the agricultural crop that is common in all the partner states. And we have done an assessment on how we can reduce on post-harvest process, especially during storage and agro-processing. So we are looking at storage and agro-processing after the harvest. And we found that most of the harvest losses, some are done at the harvest and also storage. When you look at an example of Kenya and Uganda, the maize of Uganda was being imported here. But because of aflatoxins, it was rejected because of bad storage. So we advise the technological way means of good storage so that they don't have that problem again. In terms of, that is now storage. In terms of harvest, the way you harvest until the way you store, there is a big process. And that's where most of the post-harvest losses are. So we got one from Uganda, another one from Kenya on how to handle the technologies of handling the post-harvest. And I have the assessment. I can share it with you, and you see how this one is going to be. It has been implemented in the region. We are just at the beginning. It's just we did it 2 years ago, and we are trying it in other partner states for particular crops that are being traded from one partner state to another. That is rice, maize, and the other crops. Thank you.
Very much. Over to you, Mr. Sani.
Okay, thank you, Dr. Fortin. Okay, I think most of my issues have been raised because I am interested in find out if we have a kind of monitoring framework to follow the implementation of all those strategies. If you have annual report on the implementation of the issue of implementation of regional strategy, I'm very interested to find out what is your experience.
Thank you. It is a common question and also a challenge. One, for each strategy that we have developed, it has a costed implementation plan and M&E plan. And these strategies are not for only stakeholders to implement. They are partner states to implement. Now, when we do mid-term evaluation of these strategy implementation, see how far they have gone. We don't only collect data at the regional level, but we also go to the partner states because we have focal point. If it is for artificial intelligence, we go to ICT and STI ministries in the partner states. If it is for STI, we go to ICT and STI. So we have focal points for these strategies and policies. And once we develop a regional one, because the regional one, remember, it is not as specific as the national one. The national institutions come, get the regional one and nationalize it. Get what they want to implement out of this. Not everything is implemented. And there are some which are implemented at the regional level and some which are implemented at the national level. Now, we have a mid-term evaluation and also have a terminal evaluation before we develop the second strategic plan or policy. So we use the monitoring and evaluation to guide us. If we find that some of these pillars have not been implemented, we roll them over to the second policy or strategy. Like Dr. Seke will tell you that STISA, of the activities which we never implemented in STISA, we rolled over to this second STISA. Why did they roll them? Because they found out of evaluation, they found out they were not what? They were not implemented. So you use such a mechanism to know how far your implementations have been. And the implementation plan, because it has who is responsible for this activity. And that's where you go. You are responsible for this activity. What have you done on this? Then you evaluate. And then at the regional level, you have to have both a consultant and a stakeholder secretariat to do all that at the regional level. Thank you.
Thank you. Professor Mbali.
Yeah, thank you very much for the presentation. I just wanted to learn, actually.
So how are you triangulating between the STECO and I think there's the health research in Burundi and the Department of Health in Arusha? Let me just tell what I observed that I've dealt with the people in health. Usually, I've never come across a science person in their team. And yet there are these science outfits in some of these, some of these. Now, what I know, what I can share with you is the fact that the programs that are in health from NEPAD, that actually the regs are implementing, they actually came from science and technology. Whether I talk of the MRH, the AMA, and whatever, those they're going from a science point. And I think earlier on, I think Otim, yeah, I think he was talking about pharmacovigilance. You see, the whole issue of data interoperability and what have you, it's somewhere where I think their department require the support of your outfit. So I don't know if you can just educate me how you are triangulating in your undertakings. And that's one. Secondly, I noticed that in your strategies, or should I call them strategic, sort of like objective or directions, I don't think there's any that is meant for health. Maybe we have to reserve it for the colleagues in Bujumbura. That's what I noticed in there. Anyway, I leave it here. I think you have understood my question. Yeah, thank you.
Yeah, that's a political question. But let me try my best, and Dr. Julius can also come in. Now, when they were establishing East African Science and Technology Commission and East African Heritage Research Commission, actually they were established at the same time. And the mandate is very clear on paper. It's very clear on paper. But as you know, what is written on paper, because I've failed to do my work, I also want to see where there is potential funding, there is a potential for skills improvement in the institution. So the Health Commission was meant and is meant for health research. Is East African health research. ICT and STI is an enabler. It's just an enabler for them to do. But for STECO, it is to support management and establishment of science, technology, and innovation in the region. So, and they gave us sectors. STI is not only in health sector. We have 6 sectors: education, we have agriculture, we have health, we have the natural resources, and the energy. That's another one. So ours is enabling 2 across all the sectors. We help them. Like, for example, when they were establishing the health crowd, it is a step that started with the Health Commission and USAID to develop that cloud for health information system. So we collaborate. Health and Telemedicine Conference, it is a joint between Health and Research Commission and the STECO. So we are brothers with one father. Who is the Secretariat now? The Secretariat has a Department of Health. Even us, because for us we are institution, they are the ones who are guiding health as a department at the Secretariat. If I want to have any project on health, my concept not first sent to the health department or the sector council responsible for health, where Sirius is a convener of that sector council. I come and present my concept, and then the council of ministers will say now the STECO Health Research Commission and Secretary go and implement. But our roles and the duties are very clear about the concept. Where we find we lack, we join and then implement together. So there is no conflict of interest in the three the 2 institutions and the Secretariat. we are working together as one ES. That's why when we found that, yeah, I was presenting as a step and was presenting as ESC. The step is ESC. Actually, we should have done one. We're going to look at we are separate. Now, because one child runs faster than the other, that's why you found that most of the health applications are with STEP, not with health occupation. But if it comes to epidemiology, research, centers of excellence, those ones are taken over by the health occupation. Now, if we have a program which is run between us and the health commission, it is the secretariat that guides that. They are the coordinator of that project. So we complement each other, we support each other, and where necessary, we join the together. So don't fear to come to STECO, don't fear to come to National Health Commission or Secretariat. In a case, if he cannot handle as not his mandate, I will find that he has sent the request to us. Thank you.
Yeah, if I may have that one, I think yeah, this is good. I got it. This bit wasn't in the area presentation in terms of how you are collaborating. But more important to this is the fact that what is not coming through is how you are able to develop programs based on programs that are already running within the EAC from other departments. Okay, I mean, you find that most of these programs that colleagues are running, there's a lot of need for science in there, and therefore, outfits like yours have got a lot of, potential of supporting them from the science point of view. So, just to, all I'm trying to say is, let's just bear that in mind, because I think there's a client that is right at the doorstep that we may not be supporting when they need that support. Most of these problems that the colleagues are dealing with, I think they need support. And that may also help you in terms of resource mobilization. Because some of these programs, they are sitting with money which the departments, when they do them on their own, they are losing it out, because it's like they don't have that sort of like competence, which may actually be in your department. So just check. There could be some programs that requires you guys, that you provide right there within the setup. We're just using health as an example here, but it could be somewhere else. I mean, let's say, for instance, the work that you are doing on the you mentioned of the work that you are doing on the imaging technologies, for instance. Indeed, as you said, you said you are ahead, isn't it, compared to the department, which is healthy. But then the point is now, how does it become obvious that the department will benefit from that process? So it's just a matter of building those synergies and what. I mean, synergies. I mean, I think that probably we should be mindful of. I'm seeing a lot of potential there and a lot of opportunity, because you find that my colleague Yeseke, probably all he does is he just calls on your Esteko. He's completely ignorant of these other places, and yet STIZA covers all these. You see, so because you colleagues are now right at the point where now it is now implementation, in the member states, in which case I think they would benefit from some of those things, especially, and you watch this space, the regulatory side of things. We are talking about it to be a challenge. We're going to do it very differently this time. It is not going to be those typical regulatory agencies that are in the right ministries. It now requires a convergence of sectors and ministries to really regulate these technologies. There's no one ministry that is going to be able to regulate, when you have got a basket of these imaging technologies If you want to talk of digital platforms, it's a whole range of things. So it will be ICT, it will be health, it will be whatever it is. Anyway, thank you.
Yeah, I take that as a compliment, and we shall see how we can synergize our efforts. Thank you very much.
Okay, I think one more from Dr. Elia. Another comment?
Okay, I think a bit of what I wanted to say has been said, but I just wanted to, I think this issue about sustainability, yeah, Dr. Justina raised it. I think it's an issue that always comes in. And I think when we talk about sustainability, of course, we have to enhance domestic financing, right, of all these activities. But I think for me, we don't have to be also too apologetic about the fact that the priorities that our governments are facing are also quite huge, quite serious. I mean, where the money? So every sector is going to the Minister of Finance to look for more money. Of course, we can get more resources through better prioritization. But I think for me, there's that part that we need to push, but also the issue is all this money that these donors are spending on the continent. How much say do we need to have there, and how do we want to influence it in such a way that it's spent to help build that sustainability? And I think that to me is maybe, and because I think they are not coming here because they just love Africa. They have strategic interests on the continent. So if the American government is spending whatever billions in Africa, they are not just doing that because they want to. They have strategic interests. The Chinese are coming. So how do we, as African governments, as African stakeholders, actually make sure that that money, to the extent that it's there to be used on the continent, that we ask the same questions about whether the money is we're actually it's delivering impact. Because there are estimates that go. I can give you this, that if you just estimate, I mean, capacity building in general, that is being done in Africa, how much money is invested by the bilaterals, multilaterals, all these donors, including private sector and so on, the conservative estimate is $2.5 to $4 billion a year. Moderate estimate is $4 to $6 billion. If you become a little bit liberal, it's $6 to $8 billion every year. And I think I've been in many meetings where a lot of people, whether it's at the World Bank and so on, people are now asking the questions, are we just wasting this money? Because it doesn't look like the structural changes that we need to see in Africa are coming up, that in the end is still firefighting. Is this having an impact if there's so much money being spent? And so the bigger question being asked is, how do we build effective capacity, sustainable capacity? And can we start looking at the methods that we use and start seeing whether this can be done differently? So when people are raising this question about are these billions being wasted? I mean, on the other hand, I think we ought to be able to say whether that is a correct perception. Are we really seeing capacity ourselves being strengthened? Or is it really true that this money, most of it is just being thrown away? But I think more critically, it's the issue that how do we make sure that, because a lot of people will come, define their capacity building programs from their perspective, and still the billions, they will count the money they are spending and say we put so much money in Africa. To what extent are African governments having a say on how that money is spent? And I think for me, maybe a bigger part of this is that we don't maybe spend a lot of time in setting our own priorities, so that in the end, when people are coming, rather than people come and just spread their money and tell you are failing to build capacity and so on, to what extent are we saying, if you want to work with us, these are the things where you should spend the money? So I think maybe we need to have that shift a little bit. But I mean, if people are saying they're spending this money in Africa, I mean, yeah, they can talk about, oh yeah, let's increase domestic spending and so on. But this is a big amount of money that if we had some control and make sure that it actually helped, it will help the continent to move forward. So I think that's one point. And I think in your question, in your answer, in your question about capacity, you talked also about how you are training people in universities and so on. So I mean, how should we really define sustainability? I think in the end, there isn't going to be too much new money in the government system to improve. I think it can happen, but I think that we have to know that the cake is small, and for it to be distributed, there are a lot of challenges there. But I think the issue is, it relates to the issue about capacity as well. To what extent are we integrating these issues, these interventions into routine government processes? Then that's what will become sustainable, right? Because every government is already working on that. And if an innovation becomes part of the government system, then it goes into the normal budgeting and it will improve how things. So when we talk about capacity, we talk about these trainings a lot of times, but don't pay as much attention in engaging in those planning and budgeting processes at government level that actually make sure that these interventions become part of the government system. Because if they are not part of that, then why are we going to be talking about sustainability? So I just wanted to say that, and also congratulate you on setting up this journal. I was surprised that you started off by saying it was only for East Africa. You can't create boundaries for science, right? You can't create boundaries for science, but I think it's a good thing, and I think creating more platforms where there is, I think now focusing on improving the quality and making sure that the impact factor is improving, so that people shouldn't say it's for Africa, it's only for Africans, and then it becomes more global. So thank you.
Yeah, thank you a lot. One thing which which I forgot to inform you on domestic financing. I think African Union, there is a Lagos plot of where they agitated for 2% of GDP for STI financing. So we have presented this to the sector council. Yes, R&D. We have presented this. Now we have brought the concept note of this African Union because it was passed. But people, it's only Kenya that now is giving a 0.1 something for the East African community. But other partner states are below 0.001 for the STI and R&D. So we are presenting our concept note again to the Sector Council of Ministers to look at this 2% for the national, not at the state level, no, the partner states, to give this 2% to the national councils of science and technology to implement these projects that we are doing at the national level, at the regional level, for sustainability purposes. We hope that it will be passed, because some of these countries are putting, but not a lot. But we need to reach 2% so that we have the financing for STI R&D at the national level, and then obviously our contribution disbursement from partner states will also increase at the state level. Thank you very much, and thank you for the insights in the domestic financing and the capacity building. Thank you very much.
Thank you very much, Dr. Fortunate. I think let's give him a round of applause. He has really done well. I'm now going to hand over to I'm going to hand over to Professor Agri Ambali, Executive Director, Hub for Development Research and Advisory Services, to take us through the next session. Over to you, Prof.
Thank you. Do you have my copy of the program?
Sorry?
Do you have my copy of the program?
Yes, I
yeah, sure. Yeah, okay, thank you. Yeah.
I didn't return.
Okay. Good afternoon. Yes, so yeah, we continue with the session on the application of digital technologies in the healthcare systems with examples from the African countries. So I think this morning and getting to the afternoon, colleagues have talked about it. I think the digital, technologies, as well as the digital health strategies and other view. So we've got two colleagues who are going to be lead presenters, and then we'll go Q&A. So I will invite Dr. William Waswa to start the presentation, and then after him, Dr. Kazim Abubakar will make a presentation, and then we'll take Q&A of the whole set of presentations. Thank you.
So good afternoon once again. So I'm happy to be back here, and I'll give a very short presentation about the applications of these emerging technologies and how they are really being used to strengthen the healthcare system in Africa. So I'm Dr. William Waswa from Uganda. I work with the Mbari University of Science and Technology, and I'm also a member of APET. Next slide. So as we all know that these emerging technologies really have a lot of potential to change the status quo. And I think one of the beauties of these dialogues that we keep learning from each other. So I'm sure that by the time we leave this building, maybe we would have learned some new terms. So these emerging technologies have the status of changing the status quo. These emerging technologies these are technologies that their development, their applications are really still largely unrealized. And we believe that these technologies have a lot of potential in Africa. There are quite a number of them, but APET was able to identify 10 emerging technologies that were seen as key and had the potential of really changing the status quo in Africa. So these include the gene drives, microgrids, drones, next generation medicine, artificial intelligence, urban agriculture, synthetic biology, 3D printing, water purification, and next generation batteries. And over the last years, APET has really done a lot of work in spending a lot of time and resources to really investigate how these technologies can really be tapped in to strengthen the healthcare system in Africa. And over the last years, I think 8 of these technologies have really been greatly synthesized. These include the gene drives for control and elimination of malaria, drones for increasing agriculture productivity, microgrids, artificial intelligence, 3D printing, next generation batteries, blockchain, and also Internet of Medical Things. And we are also looking at 5G. I think many of you have heard of 5G, which some people call the controversial technology. Some people say it's related to COVID-19, but still 5G has a lot of potential in Africa if really well utilized, and also water purification. But APET does not only look at selecting these technologies, but also tracking the current and future trends of these technologies. These technologies are constantly evolving, and there's really a need to know what are the implications of adopting and not adopting these technologies. What are some of the available provisional scientific evidence that can really be used to support? And we say, oh, these technologies have been used here, and this is the impact. If we actually use these technologies in Africa here, this can really happen. And also regulation of these emerging technologies is the key that is coming up. These emerging technologies need a clear regulation pathway to ensure that they can really be accepted and adopted in Africa. And also ways of improving coordination among the different stakeholders with these emerging technologies. You are going to see that we have so many stakeholders on the African continent that are really working on these emerging technologies. So it's really important that these technologies are really well coordinated. So we do have a number of white papers, call them knowledge products, that have been publicly launched. For example, we have a report about blockchain technologies powering the African vision, how blockchain can really be help to transform Africa's transformative governance and also opportunities in other areas. We have a report about drones and how really these drones can strengthen and impact healthcare systems in Africa. We do have a report on microgrids and how this type of energy can really transform Africa, as we know that we do have a lot of challenges with our current energy surprise. We do have a report about gene drives, and we do have other projects that actually have been able to come out from these reports. These reports have been taken up by a number of stakeholders, and different projects have been able to arise from these. I have a colleague who told me has been to Uganda through the VM project, and this is one of the projects that have really come from these type of reports. We have the A White paper, which is a very good document for any country that really wants to establish a national continental strategy and also some other national strategies for strengthening these emerging technologies. We do have a white paper, and we also have a paper about AI for Africa that really tells the story about AI in Africa and what are the opportunities, what has been done in AI in Africa, because many of us think that maybe in Africa we have not developed or deployed AI solutions. So this document really shows you the journey of AI in Africa. And we do have blogs. We always talk about these technologies, share insights with other people, get feedback, and we do have blogs in different sectors and emerging technologies. But I'm here to talk about how is AI and Internet of Medical Things is really changing healthcare in Africa. So AI, because sometimes we talk about AI, but a kid may ask you, oh, what's AI? And you can actually start scratching yourself. But ideally, AI, in simple terms, is training a computer to just act like a human being. The things that you used to do, be done by only humans, can be done by a computer now. You can ask your phone, what's the time now? Is it going to rain today? You can ask your watch, what's my blood pressure? These are all being emerging technologies. So AI is giving the capability to computer systems to be able to reason, think, and be able to respond and actually reason like a human being. And AI applications are very, very widely used in healthcare, in diagnostics, in medical imaging. This is where AI actually has shown that it has a lot of potential. A colleague talked about sending a radiology image and get feedback. Now with the current AI, you can get a radiology image and get results instant. So we are able to see AI used in data mining, AI used in predictive medicine, and these are all potential applications of AI in healthcare. And there are a lot of applications on the continent where AI is being used. I'm very proud of my own innovation called PAPS AI. PAPS AI is a low-cost microscope that is used to digitize pap smears and use AI to automatically offer real-time diagnosis of cervical cancer from pap smears. But we do have other innovations in telemedicine and remote consultations, like ABAP is a platform that's being used in Egypt, in Zimbabwe, to really provide AI-enabled telemedicine support. We do have health data analytics. We do have a lot of applications that use AI in hospitals that will provide data analytics, surveillance, and this is currently being used on the African continent. Precision medicine, 3D printing. We do have MedAd in South Africa. They really use 3D printing to provide 3D printed orthopedics devices that are really well tailored for the patients. And these are all technologies that are really revolutionizing healthcare in Africa. Robotic surgery, detection of severe diseases like diabetic retinopathy. We do have several applications in Uganda, in Kenya, where they are doing massive screening using AI. And we do have a lot of mobile applications. Chatbots have become common. You can interact with the chatbot, and as if you're interacting with a doctor. And these are all AI technologies, which have a lot of potential of improving healthcare in Africa. There are so many companies, there are so many startups in the African continent that are really adopting, using AI to improve healthcare in Africa. And I'm happy to say that in Africa is not short of innovations, it's only short of scaling and uptaking these innovations, but they are readily available. So when you look at the Internet of Medical Technologies, medical things, It's also an amazing technology, an amazing field that so many people actually use every day, but they really don't know that they use it. So Internet of Medical Technologies, it could be syringes, they could be beds, they could be drugs, they could be pills. So these are technologies that autonomously collect and transmit medical data over the internet. You could have a smartwatch, you collect your BP, collect your temperature, collect your oxygen station levels, share them in the internet, share them. This is all Internet of Medical Technologies. You could be in an ICU and you can monitor 10 patients at the same time. This is all Internet of Medical things. And this has a lot of potential in areas like in Africa, where we don't have enough skilled personnel. So Internet of Medical Technologies is also one of the emerging technologies that has a lot of potential in Africa. So you do have a patient, you do have different wearable devices that are put on this patient, and you have a data center, or you have a cloud where all this information is processed and is shared among different stakeholders. This technology, complex as it is, it's also already being used in Africa. So you know that Internet of Medical Technologies, those are technologies that are only used in developed countries. In Zanzibar, we do have a startup called D3. They're using Internet of Medical Technologies to help community health workers to diagnose and manage childhood illness in remote settings. We do have mobile health wallet in South Africa. They also use it to access health financing details, and they're actually able to make a lot of decisions based on this data. ComCare in Nigeria is also using Internet of Medical Technologies to make sure that they can collect data in real time and share this with other stakeholders. In Uganda, we do have Mama Open Smart Jacket. It's a jacket that they give to pregnant mothers, and they're able to monitor the vitals of the children remotely, and they can also be able to monitor a number of diseases with these technologies. So Internet of Medical Technologies is greatly used in Africa in blood pressure monitoring, glucose level monitoring, medical management. There's what they call now a wise pill, where for the HIV patients, they have a box, they put there the drugs, and every time we open the drug, a notification is sent to the doctor that maybe you have taken a wise pill, but now the patient is just open and don't swallow the drug, and the doctor will think maybe somebody has swallowed. But of course, with innovations, they've been able to put now the pill on the drugs, that when you swallow the drug, they're actually able to confirm that you have been able to swallow the drugs. And these are all enabling adherence to these drugs. And when you look at the global market of this Internet of Medical Technology, it's really something that is amazing. However, with still very low uptake in Africa, but the potential is there and the opportunities are readily available of taking up these emerging technologies like Internet of Medical Technologies in Africa. So why is such a dialogue important to a panel like APET? Because APET does not sit alone. APET is a member of 10 members, but it does not mean that all this work is done by only the 10 members. It's done through consultations, meeting experts, interaction with other RECs. And we believe that interacting with all of you and other people, we could be able to get more insights to see how we could actually shape the future of these emerging technologies in Africa. For example, identification of emerging technologies. You have identified the 10 emerging technologies, and you have really done a lot of work around there. But another important factor is to track and trace these emerging technologies. I'll just give an example of AI. AI, if you look at AI 10 years back and 10 years now, you actually wonder what's going to be 10 years from here. Because in 2021, we had what they call AlexNet. These were small AI technologies. But from 2012 to right now, where we have the ChatGPT, the GPT, the generative transformers, a lot of things have happened. So it really shows you that every year, these technologies are changing. You're not going to wait for 1,000 years, for 100 years to see what AI is doing. Every year, there are a lot of changes and developments. And these developments have a lot of potential for use in other areas. Because when you look at AI, it's just one technology, but every year, the technology is evolving. For example, I tell people that we are still just here in the generative artificial intelligence, where you have AI now is actually able to win a human being in a number of games. You have seen AI robots winning humans in games, in chess, in all this. But we are going to go to what they call artificial super intelligence, where AI is now able to do anything more than what we can do. We're going to reach a point where we have synthetic super intelligence, where AI will have human-like social interactions. you'll be able to meet profile barrier and you first ask yourself, is he or is AI? Because it's going to reach a point where you find the robot, you find AI, and it is just like the human being or better than the human being. So these technologies are rapidly evolving. That's same to Internet of Medical Technologies. That's same to 5G. We are in 5G, 6G, 7G. All these are going to come, and all are going to be having different applications and different issues that we need to be thinking about. So, and all of these technologies, all of these changes have new potential applications. For example, when you look at AI, initially AI was just for chatbot. Like you go on a website and you have an interaction chatbot. But now with the emergence of deep learning, AI has been able to be used in imaging, diagnostics. This has come also because of the deep learning. When you look at ChatGPT, has been able to provide a lot of real-time interaction with ChatGPT, and this is because of the advancements in technology through natural language processing. So you can go to ChatGPT and ask it in Swahili, in Uganda, in English, and this is all because of natural language processing. So when you look at machine learning, predictive algorithms, these are all opening new avenues for innovations. For example, right now we are looking at AI in healthcare. Maybe AI has a lot of other things it can do in healthcare that we actually do not know. So that's why it's very good to keep track of these emerging technologies. The same when you look at the Internet of Medical Technologies or medical things. Initially, they were just external devices like smartwatches, but now we have in vivo sensors like monitoring drug interactions, patient-drug interactions, monitoring cancer cells. Somebody was told him there's a project they want to invite me on. They're developing a pill for cancer that keeps scanning the body. So every time a body cells maybe becomes cancerous, so this will be like an antivirus in the body. It sends you a notification and say, oh, maybe one cell is becoming cancerous. So it keeps scanning your body in real time. So these are things that are going to happen. So instead of waiting for you to say you have cancer in late stage, you'll be able to monitor your body in real time. Integrations. It's now able to integrate this Internet of Medical things with other softwares, with other hardwares, with other data systems. And these are all integrations, cutting edge technologies integration. These days, the technology is no longer functioning alone. AI is working with blockchain, 3D is working with AI, IoT is working with blockchain. So you find that all these technologies have become integrated, and this makes the actually equation very complicated and very interesting. Barriers, people have talked about, what are the barriers? Why don't we then have these technologies readily available? So I'm very sure we know of these challenges. I no longer even want to talk about them because we all know why we have not been able to take up a lot of these emerging technologies. So on one of the reports we developed as a pet for the AI roadmap, we're actually able to identify what are some of the challenges. If you want to really uptake AI in Africa, if you want to uptake, and this actually we have seen that even the other reports, most of these are cross-cutting issues that can be adopted by most of the emerging technologies. There's really need to have human capital development for AI and these other technologies. You need to have a pool of people, not only the experts, but also the informal sector should be able to talk about AI. You should be able to talk to AI, to the legislators about AI. You cannot expect them to defend your proposals when they actually don't know what they are going to defend. Infrastructure and data foundation, this has been talked about. We need to really have infrastructures to ensure that we could have this uptake, enabling environment. This includes regulations, policies, and frameworks. There economy, there must be money. We need to invest money to really make money, and also building sustainable partnerships, including private and public, national and international. There are a lot of things I've heard today from my colleagues from Uganda that actually didn't know that were happening. So I've just realized that there's really a need to work as an ecosystem, and also building monitoring and evaluation. Like he said, for all the programs, there must be monitoring and evaluation framework. Who's in charge? Because however good you come up with recommendations and you don't say this person is going to be in charge, and also put a budget, then most of these documents may just remain being good documents. So from what we have identified, this is my last slide. So some of the needs we identified, like human capital development, is really an urgent need. So do policymakers really understand? Do the regs really understand these technologies? You want them to defend your concept or your proposal, but do they really understand this? Our researchers just consuming or developing technologies. Because when you look at AI, for example, you have what you call foundation models. I was doing some assessment, but most of the researchers are just using the foundation models and only giving them their own data set. Then they have built a new AI system, but you are just using what is already there. It's like we are just assembling the technology. So how do we make sure that our researchers can actually be able to develop new models? Can we develop our own version of ChatGPT, not only using ChatGPT and giving it new local data? Because now that's what everybody is saying. Let's collect our data. So out of NEPAD and APET, you have a concept note we are working on to see how we could really support uptake of these emerging technologies. And we also have the CJEDs. These have been key in disseminating some of this information, teaching people about these emerging technologies. About the youth engagement is also something we observe that for you to really be able to uptake these emerging technologies, you need to engage the youth. With the population with over 40% of the African population being youth, very diverse and very innovative. So there's really a need to have a lot of initiatives from all of us. And that's why we are here. Think of initiatives that can really bring the youth into the innovation ecosystem and also uptake of these emerging innovations. So APET, through what we call the CG desk, the Kalestas Juma Executive Dialogues, has also been able to deliver a lot of talks, a lot of engagement with the youth to make sure that they are onboarded. And also from one of the recent reports from APET, we just had an African youth in AI and robotics competition in partnership with Outer NEPAD, and this was also a very good competition to recognize the youth who are really doing amazing things in the AI and robotics sector. The communication strategy is something we observed, that there are so many things that we also don't know that's happening amongst ourselves. So there's really a need to push and make sure that people understand this. So do our innovators, researchers, RECs, and stakeholders have done a lot, but a lot of things are not known. So for example, I'm so happy with the integration of AFIDEP with Outer NEPAD and APET. So we are able to also disseminate a lot of our work through policy briefs, infographics, the podcast. I think these are very good strategies that can really be able to promote these emerging technologies. Myths and misconceptions. When I talked about AI is going to surpass many of us, and so many of you are very scared. But you shouldn't. We should actually be very happy and proud, because we're going to be doing other things. We're going to leave the regular things we are doing and concentrate on other things. So there's really a need to make sure that people do not have the fear, because once there's that fear, nobody's going to appreciate these technologies. Infrastructure and funds, this is really a challenge that we need to work together. Policies, guidelines, and laws, there's a need for continental and national strategies to ensure that most of these technologies are easily taken up. And also regulation, I think that is my last point. There's really an urgent need to establish regulation pathways for these emerging technologies in Africa. Thank you so much.
Thank you, Dr. Waswa. I think this is quite elaborate. Can I call Dr. Kazim Abubakar?
Hello, good afternoon, everyone. Right, thanks for the opportunity to share with you within the next couple of minutes what I feel is the position and how to, I think it's a recent mail. Okay. All right, so my name is Dr. Kazim Abubakar. I will be sharing with you application of digital technologies, precisely drones and blockchain technology for health care. So I feel there are linkages, of course. We've spoken about the linkages between now, why are we here? And what exactly are we interested in achieving? All of us are tied together as a result of the Agenda 2063. And we also have this TISA 2034 proposed. And these are one of the reasons why we're here. So, and then we have a case for Africa. What exactly have we been able to do as regards drones and blockchain technology? I will be talking about that, and then the challenges, and then considerations, recommendations, and then conclusion. So I would like to acknowledge everyone here. This is Africa. This is who we are. Now, why should this give us concern? Why should my question every now and then is, when are we going to stop? Consuming the technology. I'm looking forward to a day where we have a blue chip company developed in Africa, our own, and not domesticating the technology. What we are doing now is we are trying to domesticate the technology. But what about our own? Now, if we're able to identify from any African region, any of these MSMEs coming up, are you aware that China is funding their organizations and deliberately going to government to ensure they secure contracts? How much of that is happening at the African region? So I want us to look at it and ponder over it. By the time we are done, can we go from here and decide to say we are taking only one product out and we are supporting it as a region, as an African continent, and we are pushing that forward beside the policy concept? And this is the reason why I flashed all this. Now, of course, it's already no gain saying that in the very nearest future, we are going to intimidate the world, right? We are going to intimidate the world. But I keep saying, I give an instance with Nigeria, my country. We are to China what China is to Asia. That's what Nigeria is to Africa in terms of population, in terms of the expected facility, in terms of the capacity and capability. But how much have we been able to use? These are things we have to ponder on. That's why I flashed this. So we have the potentials here, and no one can do it for us. In fact, I want us to start by consuming ourselves, what we have for ourselves. Before you pick up that product, have you thought of, is there an African version? Have you thought of, is there a Nigerian version? Because if you pick a piece, look, the Chinese come to this place, they snap pictures. We were at different fora. They snap pictures to see what you are consuming. And then they go back, including our adire, our local national clothes. They go there and fabricate and ship to us. This is our continent. This is the expectations that is expected from us. This is the reason why I flashed this. I know all of us are aware of this, but I need to tell us this is it. So, healthcare, how far have we gone? And what effort have we made so far? It started in the 90s up until 2023 to 2024. It started, of course, by identifying the issues, and the issues were obvious. However, you are aware that we have local content products that are still doing well. Now, how much effort have we been able to do to take those local content and push it to regional level? In all our countries, we have local products that our parents are consuming. We are also consuming them, but we'll never be able to push one or two to regional level. So, but we have the Free African Trade Zone, right, in place, which can support the movement of these services and products. So, of course, in the 2000s, it began with Nigeria and Malawi, where they introduced ICT. Yes, we were involved. My agency was involved in the support capacity building, in setting up collection of records, especially we started from Abuja, all the hospitals in Abuja, how they can commence. And that was the early stage when it started. So we started by collecting information from the analog, we went to digital, and we trained selected doctors alongside the Ministry of Health and Ministry of Innovation, Science and Tech. That's my ministry, to make sure we support the system. And that was why I pointed out to in the early 2000s. 2024, we are now into electronic health records and like that. Now, the healthcare sector in Nigeria, one of the major concerns we have now, if you look at it, the National Health Insurance Scheme. Other countries borrowed Nigerian National Health Insurance Scheme, but I think they are doing better than what we are doing right now. Yeah, we have less than 10% of the population, but 10% of Nigerian population is about, because we're about 220 million already. So 10% of 220 million is equivalent to at least a particular country in other African regions. Yes, but what I'm saying is we have about 10% of the population covered in health insurance scheme. Now, what is happening now is we are now using technology to make sure that even the 10% that are covered. Now, in my hospital, I don't know the last time I went to the hospital, but I interact with my doctor now using Internet of Things and all that. So he has all my medical records, and then he can ask my kids. In fact, he sent mail to my children to ask how they are doing, and then we respond in Abuja clinics there. So these are the efforts we made so far, but it started, the information we started when we made sure that the hospitals began to transform their data from analog to digital. Now we are enjoying part of what we bought. One constraint, these are part of what digital technologies can do. We've known them already. It can generate and transmit information, but these are things that I know we can quickly achieve. Now, the concern here now is that, you see, Zipline, I'm not celebrating it. The reason, I'm a Nigerian, I'm an African, I like local content. Zipline is not African company. Let us bring up one African, yes. Let us bring up one African company. We have the drones, right? We can build drones in Africa. We can domesticate ours. We can bring up, look, they do it. What they do is they fund the company and then they push it to Africa, right? And then we keep consuming. That's why I'm not celebrating. So I want to celebrate an African company building a drone for Africa who knows our terrain. We know ourselves more than any other person can know us, right? We know our culture. So if we have that, I think that's the reason why I'm not celebrating it that much. But I'm celebrating the fact that we have been able to domesticate it. But I want to challenge all of us at regional level that this is the way to go. No matter how, yours will continue to be yours. And no one can do it better for us because we understand ourselves better than any other person. Right, Dr. Sani? You know what we need. You know what we need in my state. You know what we need in my country. So if they design a technology for us, it will not suit, it will not fit in very well the way it's supposed to fit in. So, but these are things that they've been able to achieve using drone technology in my country. Selected states are already using it. We have Bayelsa as a result of some of the challenges in the oil exploration areas. So we now use drone to take products. We also use it in Kaduna as a result of some of insecurity. When we have issues with Boko Haram, when human beings can no longer go there. We use it in Borno. The drone technology has been used in Borno. In fact, we work with some young guys in Borno State, and then that is what we are able to do. But meanwhile, we are still using imported technologies. The only thing we are doing is we are domesticating the application, right? So let us build our own technology. Who can understand us better? So the link, here is the link, universal health access. That's what we're approaching. So, and that is where drone technology and blockchain technology can support. Blockchain technology, we're already aware that the most important thing is exchange of information. Now, if you observe, okay, I like some African presidents who insisted that they were not going to die except on their continent. Because you see, the health record of our leaders are not in our continent. True, right? So they won't exchange it. But good enough, by the time they get there, they also notice that it's Nigerians that are treating them. Honestly, we had cases. They flew there, and then the man waited for days and lodged in a hotel. And then when he came, a doctor from Abuja went to UK and treated him. And he said, oh, the same you? He said, yes. But when I got to the hospital, I was told I was waiting. He said, yes, this me. And it will be paid in pounds. That comes to enabling environment. You see, we have all that is required. But maybe our environment is not enable enough. What do we call enable environment? You see, we young guys, we need money. Honestly, that's the enable environment. Besides, if you get all the technology, but you're not paying well, they will still leave you. If you offer me dollars, why wouldn't I leave? So that's it. You hear people going to one place or the other is because the environment is attractive. It's because somebody was in Abuja and she said she would like to get a villa. That's what I like. Meaning, let's patronize our own. So meaning that if we have the good things that the young men are looking for elsewhere, they will remain in Africa and they will be scared to challenge us. We are driving the economy elsewhere. You know, there's no gainsaying, which means if we decide as a continent, we will intimidate them. honestly. And everybody will come here because we have the resources. What resources do you need in Africa that is not available? Is it natural? Is it human? Is it intellectual property? Is it facility? Is it endurance? Is it resilience? And all that. We are very resilient. So these are things, I just want you to see how it's linked to show that CISA 2034 and then the second year 10 years agenda are all supporting what we are discussing. That's it. How? You see, we have the Agenda 2063, and it keys into member science, technology, and innovation policies. Of course, at ECOWAS level, with Dr. Roland, with other member states, we have a policy, science, technology, and innovation policy, which has already been assessed. Now, the Nigeria Science, Technology, and Innovation Policy, developed by my agency, National Center for Technology Management, keyed into the EcoPost, and then identify relevant sustainable development goals alongside with support of UNESCO, and then that was how we developed that. Now, the STI policy has components of health policies and health aspects in there. Now, because it's a stakeholders engagement approach that we did, the health was represented. Like you are aware, science, technology, and innovation cut across all, enables all. So health is a component. So in a nutshell, all the policies that are implemented in the health sector in Nigeria picked their strength from the component of the science, technology, and innovation policy. And that's how it is. But look at the approach that is expected here. One thing I would like you to point out is Africans in diaspora. All of us are not talking about how to explore Africans in diaspora, especially with the IoT. We can, because they are doing great things there and they are happy. That's why Nigeria established a commission for Nigerians in diaspora. We have that to make sure we explore these potentials in them, because they won't come back. If they want to come back, some are coming back, but if they want to come back, they will ensure you can give them equivalent to, if not more than, they like their countries. It's not if they don't like their countries, but they are all there to make sure they make ends meet. So if you can give them and you make them to be important on the African continent, I'm sure we can take advantage of that. And of course, within the triple helix or quadruple helix, national health insurance system is there. And then these are all the things that at the end of the day, what do we expect? We expect affordable health care, increase access to quality primary health system, at least 40%. And these were part of what the Agenda 2063 and then CISA 2034 is trying to work on. All these are what we are expected to meet. It means through this dialogue, our intention should be that we should be looking at how to increase access to primary quality healthcare services to at least 40%. That's what the documents say, to at least 40%, which means now we have not even gotten up to 40%. Now, if we are looking at to at least 40% and we're looking at 2063, how can we achieve that? I think that's my thought now is if we want to explore Nigeria, Africans in diaspora, it may support us in achieving some of these expected goals. In the area of policy and the industry, I can assure you, most often than not, run faster than the policy you are developing. They do. They do, because your bureaucracies are so challenging. They are out there to make the money. They take advantage of the time. You see, if you look at the data that was trained to develop AI, you tell me, how many billion dollars that were trained? How much of it was from Africa? So that's why you can domesticate it well, and it will suit you well. Because how much of the data do you have access to? Where are even the data bank? The good news is Nigeria is now trying to design science, technology, and innovation data bank. Of course, we have science, technology, and innovation dashboard, which my agency designed, spinning from the Outer NEPAD, Mr. Seke's idea, when 4 countries were chosen. Now, Nigeria decided to go ahead by developing a first prototype in 2023. 2024, we've developed the second prototype, which I'm managing the process now, but it doesn't stop there. Our interest is to see how we can facilitate, how we can enjoy the knowledge that we have from our Africans or Nigerians in diaspora so that they can support some of these things we are doing. So this is what is expected of us. So Where are they? Already we've had cases from Rwanda, Ghana, Nigeria, Ethiopia, and South Africa, etc., etc. It's true. Especially, I can say that of Nigeria. I've told you some cases, some states that is already implemented. In Africa, what do we need? To supply, planning and coordination, to plan delivery and routine and schedules. You see, now look at it. Honestly, we have to consume, we have to make it ours. Now, if you go to Google, that is where all of us visit, Google Map, isn't it? It is not designed by us. They don't know our locality. Honestly, sometimes when you key in some of the information, some of the things, if it is not updated, so I know my terrain more than Google. I can close my eyes and tell you where my locations are. Honestly, that's the truth. Because you know it's my terrain, isn't it? If it were African, you understand? If it has local content in there, honestly, it will understand it better than, honestly, that's the truth. I know they have regional companies, but they can understand it more than the way we can understand ourselves. So, but of course, for now, for planning and coordination, drone is helping to do that, to deliver products in there. Then for location identification, Internet of Things and blockchain is used for that. Loading and dispatching of blood vaccines and then medications and carefully packaged dispatch for central hub or base stations. These are things that drones are being used for temporarily, currently now in Africa. This will support us in efficient and effective delivery of medical supplies. No gain saying that any longer. Now, GPS, navigation system design to handle various terrains, and weather conditions where human beings cannot get to. I told you that drones are already doing that for us in Nigeria. Now, how do they operate? Primary use, process, and then impact. What we observe is that the essential medical supplies is what they can key in. Now, my organization, to support this process, we have a blood donation app, which we designed. We did this blood donation app as a spin-off from one of our projects. We are an R&D institute, but we have spin-off from some of our collaborations. Now we designed this blood donation app using the information, especially the information on the platform that we have with access to blockchain information that we have all over Nigeria. And then we are using that to ensure that people that need blood can easily go identify people that are ready to supply the blood, and then identify their blood group, and then key into the donation, very close nearby location. Because you want to give out blood, you don't need to be going that far. In fact, he wants to give out, if you can come to his office and collect the blood, he or she will be happy, right? So, and this is one of the reasons why we supported that. So hospitals place order via text messages. That's what is obtainable. And then the drone deliver it in 30 to 45 minutes. Good intervention. And over 75 reduction in time delivery. These are some of the works that are done, especially they're already published by Asaba and Co. So Rwanda drone technology, we've mentioned that earlier. The Ghana drone technology, you've seen it. Zipline is behind it. The Ethiopia drone technology, you've seen it. The South African drone technology is also there. What it does, it's also works with South African National Blood Service. Implementation details, they use it even up to regional level. Cape Town is there using it. Eastern Cape Town is using it. They use it for transportation of blood. The major things drones are used for in Africa, and of course with peculiarity to Nigeria, is to distribute blood and then to take drugs to places where human beings cannot easily access. These are things that it's used for. Blockchain. We've seen examples from Rwanda, Ghana, Nigeria, Ethiopia, South Africa, and all that. Now, the purpose of using blockchain is to improve the management of patient records. It started, like I told you, especially with inference from Nigeria, where we started migrating the data from secondary, from hard copy to computer-based. Now, which means doctors can now key in the information, and then it can now go, it can be accessible online, so that we have a repository where it can be dropped. But the blockchain for secure medical record keeping and pharmaceutical supply chain transparency, that's what it does. So other emerging technologies, the AI for diagnostic is one of the things. Mobile health app are being developed. We have quite a lot of them in Nigeria that are developed mobile app for health applications. Now, other areas that Rwanda is currently exploring based on the survey is in the area of secure patient data management, vaccine tracking, and maintaining medical records. They have been able to use that as a way of supporting that. AI algorithms have employed for real-time tracking of disease outbreaks in Kigali, Rwanda, surrounding areas. So these are the areas where AI is supporting in tracking diseases. In our own case, what we do to support the process is only captured on our STI indicator dashboard platform. On our STI indicator dashboard platform, some of the STI indicators that are health related, what we did was to do an AI-enabled, with our human data, use AI-enabled research, and then incorporate it as part of the dashboard. Meaning you have the human data on one side that is collected and analyzed by human. We now upgraded from that, and then you have the AI-enabled data. We first did it with simulated 6 times and saw the correlation very close to what the human data was able to generate, but we identified with a caveat on the dashboard. This is AI generated. Now you can benchmark both the human generated data and then the AI generated data on the dashboard, and then you go to the one that concerns health, the one that concerns agriculture. We've categorized them because, you know, STI is cross-cutting. So in Kenya, they have shared BT Hub to do that, and then they use it to monitor cloud-based database. They use that as a resource to One Health concept is another emerging concept, especially in the use of AI or emerging technology in health. And this basically is saying independence between human, animal, and then environmental health. Is saying that you should develop an approach that recognizes that there is independence between human, animal, and environmental health, making it particularly relevant in African context with zonic diseases as prevalent. It's going to help us in Africa if we can explore this further. Of course, we have the data now that we can now access. We can now think of how to further explore the One Health concept, like what the emerging technologies can do in the aspect of health to be able to strengthen that aspect. Challenges and considerations. Challenges are already mentioned. I'm not going to overflow this, but I'm interested majorly in the area of social and economic barriers. Our Africa as a continent, our unique social norms needs to be understood and needs to be inculcated, embedded in all the technologies we are developing so that we can enjoy the use of such technology. And that's why I'm concerned about the social and economic barriers. Beside of course, there is knowledge of illiteracy. But what I'm saying is this, it's not as if it is illiteracy. Some people cannot speak English. It doesn't mean that they are illiterate. They can speak their mother tongue and they can understand. What it means is if you can translate these, and that's what I'm peculiar about the social and economic barriers. If you can translate these to what our African continent can understand, we can explore and enjoy the benefit of this technology better. So instead of saying they are illiterate, we are saying we should domesticate the technology for them to understand and take advantage of. Of course, policy regulation is already there. All these are already mentioned. Consideration, baseline research. Now, if you don't own it, anybody, he blows the piper, he takes the tone. If you go for some juicy offers, of course, the data is not for you, right? Honestly, it's not for you. But of course, you get the juicy offers. But what if you have our own baseline that is for us, honestly, and meant for us only? That's why I brought up the issue of baseline, user-centered implementation. such that we can domesticate it better for us. I think this is important for us. Now, it is usually expensive and it's usually challenging, especially when you are talking to the policy makers, I mean, the decision makers, and then the funders of this project, because science, technology, and innovation outputs are not measured in bricks and mortar. They don't understand. They feel you have to build the road. They feel you have to build the 3-story buildings. Ours is not like that. But we'll keep paying for our stupidity. Anytime I have the opportunity, I tell them, the stupidity you are paying for is that you won't pay for the research. It's true. You won't pay for the research. You expect to get the output of the research I use. It's not yours. It's going to be domesticated to those who funded it. So, but if we pay for the baseline, it is ours. We can then claim it, and then we can now domesticate it. And we can even fine-tune it, because there's no research that doesn't have benefit economic undertone. So once you have a research that is not baseline, meant for you, definitely, it can be user-centered implementation. It will be meant for those that are expected to use it. So we should think local and act global, meaning Africa can produce some of these products and services and then target the global market. We are everywhere in the world, actually. So, and these are quite a lot of things that I've brought up here: user-friendly design and all that, stakeholders' involvement, because here we are talking about how to use Internet of Things, blockchain technology, drones and all that. Now, the industry, and usually sometimes it's always my concern, they implement. Sometimes, like I said, they are faster than we who are thinking of formulating the policy, because they are interested in the economic benefit. And of course, there must be a reason for a season. The reason for their own season is that they are interested in return on investment. If the return on investment is juicy, they go for it. So they don't even want to mind. Sometimes we are talking about breach in data. They don't even consider it sometimes. But we as a government is our concern, because if the name of Africa is stained, and you feel for it, right? That's why we are concerned, because it's our role. But for them, we need to try as much as possible to bring them to understand the reason why they must be part of this. So these are part of the things I wanted to highlight about stakeholders' involvement. Recommendations for scaling. Collaborative framework. It's obvious. Now, if we lead this platform and we have a very strong collaborative framework that can support all the policies and consider all our understandings, especially at country level, is going to be important. Investment in infrastructure and training to improve adaptation and diffusion of technology. Now, when you're talking about capacity building, technology phases. Now, in technology adaptation, you need to have the adaptation capability to be able to appreciate it and domesticate it. If the adaptation capability is low, which means you may not be able to even appreciate it before you domesticate it. So these are the areas, I think, and of course, partnership with private sector and international organizations. Conclusion: the future for healthcare is emerging technologies and is digital. Thank you for your time. So I just leave you with this to show you the linkage and where you can think about this. How can we ensure emerging technologies that are already listed, and then the robust science, technology, and innovation policies and health policies, build resilient health system for us that is transformative access health through the use of AI-driven solutions, through the use of all other technologies that can support the process. I think this is what we need to think about, especially as we're talking about that. So thank you for your time.
Thank you very much. Yeah. Why don't we give a round of applause to the two colleagues? Sure, you would appreciate that. The fact that I mean, it's a late afternoon sort of accession, but then it's the two colleagues, are so passionate about the subject, isn't it? Yes, which is quite good. So thank you very much to the two colleagues, I think, for taking us through this siesta phase, and still kept most of the people except me awake. Yes, we got time for a few questions and, points of clarification. They are just have a sense of where, who wants to say something as a person. Yes, Sunny, okay, who else? Yes, yeah, who else? Hello, who else? Okay, I'll put my name. Is that it? No, 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 no. It's either you tell me that you want to ask a question now, or shall I hold on to your peace? Okay, so, Sasani.
Professor Ambali, okay. Just first of all, to congratulate the two presenters. It's very important what they present to us. My first issue is all those presentations, are they still available for people, for the participant to download, or it's later on you will make it available for us? Now, I don't know if there is a reporting team for this dialogue, because to me there are some key messages that's coming out from the presentation. So really, I want, if we have a reporting team, maybe to capture some of those key messages. And what Kazim insisted on, the issue of really, instead of just be around to domesticate all this thing, really we have to wake up and do the thing by ourselves. We are talking about research, but what is very puzzling, even in our institution, if we have to develop a policy document, for this you have to call on partners to provide that fund to develop policies. If you are not able to fund development of policies, my sisters and brothers, how can we implement them? To me, it's a shame for a regional body to ask a partner to come to provide fund for us to develop policy, even to involve some outsiders. You know, I'm working with countries. If I go in a country like Nigeria, I saw the policy document and who they involve. I feel very, very embarrassed. No, it's not all the manpower I know in Nigeria. Is there a need to involve someone else to develop documents for you? Although that thing we can do, but we don't pay attention to it. Just we are around to accept everything. So to me, that's the key messages we have to might be the reporting team, they have to put, even if we discuss them later on or something. So that's my comment.
Thank you. Maria?
Thank you very much, Prof. And thank you to the speakers for the presentation. I just have a comment or maybe a question or something we can think about. Dr. Bubeka, you mentioned that we have the resources, but my question is, do we have the enabling environment? And if we have the enabling environment, are we doing enough advocacy to ensure that the policies that policymakers make are favorable to our innovators or for the STI economy to thrive on the continent? Thank you.
Thank you. I think I said I was going to ask a question. That's both of you. In the mix of these technologies, the presentation of the two presentations were very clear. Wow, it's not just a single technology, it's a mix of them that can deliver much bigger impact than each one of them in isolation. How are you handling the issue of regulatory sort of like requirements for those technologies? I mean, in your case, Dr. Baka, you gave kind of like how you are doing those technology mixes in Nigeria. Yeah. How are you regulating? How are you regulating them? Because each one of those belongs to a different ministry. And then on top of that, you are serving a patient who belongs to the Ministry of Health. So yeah. So so those are the questions that comments and questions. I think there was an administrative one, Mr. Sani. I think the presentations, if any one of us feels like their presentation is confidential, that they will not want to make it available, please inform the organizers. Otherwise, I mean, I think you know, they would make it available. But please, if yours is, you know, you feel like you want to maybe take out some information, then you know you can do that. But I think definitely they should be available to the colleagues. Yes, there are reporters around, so I think yeah, that'll be process as you've indicated. Other than that, to our resource persons. I don't know who starts. Between the two of you. Okay, fine, sure, go ahead.
Thank you. All right, so I'm going to start with the last one by Professor Ambali. How are we managing? How are we going to manage the regulatory framework requirements? Okay, I give instance with Nigeria. Now, at the top, we have National Research and Innovation Council, chaired by the president. So the responsibility of the National Research and Innovation Council is to detect the direction of research in Nigeria where the government is interested in investing. The president chairs that. The Minister for Innovation, Science and Tech, the ministry of where my agency is the secretariat. If the president doesn't chair, the next person that can chair is the vice president. So the vice president may only chair if the president doesn't chair. Meaning, since the minister is a secretary, other ministers are members. And since ministers are there, for any meeting that is chaired by the president, now science, technology, and innovation policy, before it was approved, it was taken to the Federal Executive Council. DG Nasetem, alongside the Minister of Federal Ministry of Innovation, Science and Tech, took it to the FEC, and then that document was approved. Issues were raised as to, in fact, issues that were even raised has to even do with, how can you say science STI? That was the first thing we started. And then we clarified, STI does not mean sexually transmitted infections. It is science, technology, and innovation. So the Minister for Health got that clear. And then another issue came up. Professor Pantami, in charge of communication, ICT. The notion is, when you talk about innovation, they feel it's only ICT. And then he said, this policy is for Nigeria. Now, where is the role of ICT? Why are you saying it's science, technology, and innovation policy? Whereas, why don't you say it's ICT-related policy? And then the issue came up. And the Minister for Agriculture said, so a lot of things played. Finally, the policy was accepted. In that policy, health is covered, agriculture is covered, and all other sectors, because it's science, technology, and innovation covered. Now, The next line of action is the implementation plan. The implementation plan has not been ratified because we got caught up along the line with changing government, and then the financial aspect now changed because of inflation and all that and some bureaucracies. That's why the implementation has not been signed. Now, what I'm saying in a nutshell is once the Federal Executive Council approves any document, it is government that has approved it. If there are issues of security, issues of bridging of whatever, issues of regulatory, ministers will sort themselves out at ministerial level. So that's what we're able to do to manage the situation, while not, because state governments also have their own. So at council level, we have Science, Technology, and Innovation Council. One of the councils is just recently headed. Now that's where state governments, like provinces, they call them now, other places, come together and then bring their idea so that it can be ratified and it can be part of the national science, technology, and innovation policy. And once that is accepted, whatever the case is, we run with it. So the issue of regulation, I'm not in line with this, will be settled at ministerial level. And that's how states can now implement, because once we have it at federal level, we now domesticate it to state, we now have state science, technology, and innovation policies like that. That's how we do manage that situation. Now, in terms of health, now the culture, that's why I mentioned that our cultural, social norms should be considered. Of course, Africans are very secretive about our health. We don't want anybody to even, in fact, if I have malaria, maybe my wife doesn't want to tell the next person that he has malaria. They won't say it. So how do we manage that? We ensure private information as regards the patient are not reflecting in any of the data. That way, you can't hold anybody responsible because your name is not reflecting. And you do not have any of your personal identification. So it's not reflecting. And then we now work alongside with the national NIN, National Identification Number. That national identification number is a policy that is already accepted by government. So if you are enrolled on national identification number, your blood group is already captured. So these are where we're able to synergize that process. Can I take the one that has to do with enabling environment, Maria? Do we have the enabling environment and then the policy advocacy? What level? Enabling environment, average, not as expected. And as far as government facilities are concerned, in Nigeria, they can't compete with private sector. So what the government does is to enroll, especially during the National Health Insurance Scheme, because you can choose the hospital you like to patronize. So those high-tech facilities are there in private-owned hospitals. Now, but of course, the National Health Insurance Policy sits on top of any other individual company that comes in. So once we know that that's the policy, anybody can access that facility through the National Health Insurance policy. So what we now do now is we now have state health insurance policies such that we now domesticate it that if you want to pay 1,000 naira, I don't know how much 1,000 naira is in Kenyan shilling now, but if you want to pay as low as 1,000 naira, you can enroll with 1,000 naira. And then when you enroll with 1,000 naira every month, equivalent to 1,000 naira every month, you can now access the facility that the federal health insurance can access at state level. That's what we do as regards that. Now, to create an enabling environment so that these experts don't go away, honestly, with Nigeria as a case study, we've not been able to quickly harness that. The effort made by the government is to make sure every now and then, whatever is happening at the private sector, they jack up the pay to be at par with private sector, but they may not be able to maintain it because the private sector charge more. The private hospitals charge more than the government hospitals. So it's usually difficult, but the best brains are in the government hospital. For sure, no doubt about that. So what the private sector do now is to borrow the best brain from the government hospitals and run the private hospitals. So that, yes, so they now exchange resources. They have all the information on the database. So they exchange, they know them. So they exchange that resources. Private sectors are good, well established, but if they don't have the capacity, they go to the hospitals, government hospitals, and then they work for them. After all, they don't work all around the clock. So whenever they have the time, they go there and serve. And that's what I know about that. The policy advocacy is still low. as far as policy advocacy is concerned, is still low. I believe we need to do more. We need to do more because I think government don't spend on advocacy the way the private sector spend. Look at, if you own your email now, for instance, what you see that will be flashing on the dashboard there are private-owned companies. It is difficult for you to see government-owned organization to flash information. For instance, say, Alja Nepal, now flash science, technology, and innovation indicator, only one, just choose only one, and keep flashing it all over Africa. It's difficult. But if you see private sector, they flash it. So, and that's part of advocacy. We need to strengthen that area of advocacy to know that, to blow our trumpet, to know that what we have is what we have at disposal. But of course, the resources are there. I'm sure the Nigerian government is not broke. Prioritization is the major. They are not broke. They are not broke. Because when there's a need, they invest in the area. If you can justify it, they will invest on it. And one thing they've just lately do now is the top-bottom approach method of funding. The government don't release money to government agencies. So now a government personnel cannot execute any project. You execute through the contractor, with the exception of selected R&D products and services that they can't invest. So these are the ways I think we are doing. Dr. Sani? I think that's all. Thank you.
But also, meaning you can pick up whichever one you want to do and whatever. Over to you.
Work on these regulation requirements frameworks. So one thing you have observed that it's good to have the national regulation frameworks, but also good to have national capacity to make sure that countries can really be able to domestically and be able to come up with their local frameworks to support the regulation. Because each country, when he was talking about the framework, I was trying to compare it to how it is in Uganda, and there are basically a few changes. So it's really good that every country is empowered to come up with national strategies. Thank you.
Thank you. I think, one thing that is key for this, I think, is that what is kept on repeating, I think gave it away, baseline. If the baseline is not ours, yes, these tools are no good. Baseline is very important. I mean, that is really, it touches on everything, isn't it? Whether it's in pharmacovigilance, genomic medicine, I think it will be talked about tomorrow. All these things that we're talking about, if the baseline is not from our own data source, then I think, we will not get the best sort of like, of this, of these applications. That's where the bias comes in. Yes. So really, I think you do agree with me, colleagues, that this has been quite, an exciting session whereby the colleagues were very passionate about it, and therefore let's give them a round of applause before I hand over to them. Thank you. So I think at this point, let me leave it to our hosts to advise us if there are any logistical issues that we should take into account. Otherwise, this session is now closed. So I don't know whether it is you, Rosie, or
It's me.
Okay, fine. Thank you.
Yes. Thank you very much, Prof. Abali, for moderating the session. Before we close, may I kindly request you, once we've closed, to share with me your boarding passes, please. And then I'll hand over now to Dr. Elia to give us his closing remarks for today. Closing.
Wow, this has been a great day, huh? I haven't seen anybody's people on their computers, but you think they might be on emails, but they are really just internalizing, yeah? All right. Really, this has been a very, very great day, starting from the beginning with those warm welcome remarks. The from the Rex and the official opening of the meeting by Howard Nepad. And then we got those the illustrations of the emerging technology, what is happening in the Rex, and then came up to also look at what the Rex are doing on STI. And finally, we have these two presentations this afternoon. One where Dr. Waswa, I always tend to think that to call him professor. Doesn't he sound like, huh? This is this, when are you becoming professor, prof? Yeah, we wish him well, but really, and then our brother here from Nigeria who came and I went there and met Bobby and said, Ish, the guy there is on fire. I left. I left because I was like, I had somebody called me and I had to take care of something, and I missed the fact that I missed the second part of your talk. But I think so. I'm not. I don't think that I'll even attempt to give highlights of this. I mean, we've seen. For me, what has really touched me is just to know that a lot is already happening, right? The Rex, different sort of corners of this and that. I have to say that I think East Africa has kind of, by having a whole commission for STI, they have kind of taken the game to the next level, right? Because now you have a group of experts who are championing this in the region. And one of the questions when we're talking about somebody asked, do you have a monitoring and evaluation framework on what is happening? I think maybe that question can be asked of all the work that the Rex do, right? But for me, the question I wanted to ask is, I wanted to ask him, and maybe I can still put him on the spot now. Like if a Rec needed to come to ESC and say, we want to learn what impact this or what difference this is making, and for me to go back to my rec, like ECOWAS. If my brother here from Waho said we are considering having a commission as well, what would you say are the main things that what difference, if it wasn't there, what would East Africa miss? How do you summarize that? Do we need to have it, or it's okay to for the other recs to continue without commissions on STI?
It's a hard question, but looking at we developed the first strategic plan and we evaluated it. So 3 things came up. One, the increase in uptake of innovations. There have been an increase in uptake of innovations and commercialization. That's one. 2, there has been an increase of science, technology, policy decisions making. These are decisions being made at different levels of the ministries using science and technology data that we have generated, policies we have developed, and activities that we have taken place. So the policy makers and decision makers are making decisions using our best practices and the data and information to make the right decision for the country. 3 is the awareness, which I've seen in our partner states. Before you would talk of science, technology, and innovation, this is what they were learning from the universities, what applications are being used, and they are seeing them on ground. And they are also seeing them they are using them on their daily lives. And they have also helped them on navigating their challenges in terms of living, in terms of how they do work, and also how service is being delivered. The third or the fourth, um, yes, 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 please. Yeah, they are welcome. Yes, yes. Number 4 is the capacity building, of which we have partnered with the academia, the industry, and the private sector. Originally, people would innovate, and their innovations end there. They are not even put on the market. Nobody is using them. But now linking innovators with the industry. Let me give you an example. We have 4 innovators that we have linked with private factories. They innovate, and the private factories take up the innovation, and they commercialize together, and the innovators are able to earn, and then these products are put on the market. So before it would be you innovate, what you innovated remains with you. It's not put on the market, and it is not commercialized. So those are the few I can put, but I can have a long day with them and tell them the reason why they should have a Science and Technology Innovation Commission in their respective recs. Thank you very much.
Thank you, sir. I think we can give. Now I think it's going to be the commission ambassador of this initiative, so that yeah, but I think a big part of why we are here is also to learn. We don't reinvent the wheel when we think about something, when a colleague in the other region has gone through the experience of forming this sort of a platform. But I think even if the other regions, the other regs don't have commissions, I think we've seen the work that they are doing. There's still a structured process. But I think there's a lot. So as we go forward here, as we think about these the role of emerging technologies in health, there's this monograph that has been written. What was being presented here, some of the highlights from that. I think that's what we'll also look at tomorrow, right, Rose? Yeah. All right. Yeah. So I think this is really a good way of making sure that if the RECs can now champion these issues in our smaller groups rather than do it at African Union, where we are dealing with 50 plus countries, there is likely to be more consideration of issues that are common in our regions and so on. So really, it's been a great day for me. There's that aspect about learning. I sent a tweet. I don't tweet too much, but I sent a tweet today. We say a tweet still, or we say I sent an X. Yeah, but I was like, this meeting has started. It's really great. I was summarizing. I was looking at those questions that the Rex were saying. What do they expect from AUDA, AFIDEP? Or I mean, we looked at that as all the other organizations that are here. I think one of the issues was this issue about really how do we come up with these regional regulatory frameworks and policy frameworks so that if the regs come with those, define those for their regions, the countries will start customizing, and that's how we'll get the countries to go forward. The other issue was the issue about data. I think there was a point that the data revolution needs to be part of this. You can't have STI emerging technologies that it's not grounded on sound data, right? The third one was the issue about capacity building. They need to build the capacity to understand these issues, to evaluate them, how to integrate them into systems and so on. There was a big issue about sustainability, which was how do we make sure that this is not just ending with these donor projects, but they really become part of the system. Those were my 4. If you had to pick up your other issue that I haven't mentioned, what would that be? What stood out today? Of course, I think the issue about having a platform for cross-country, cross-regional learning is very, very important as well, right? All right. Yeah. Are you the one who mentioned it after I left? Oh, that's what I missed. All right. I think I wanted to say I'll buy you a beer so we talk about this. I think we'll just have coffee. Yeah? All right. Yeah, I think there's the diaspora as well. I think when we look at this capacity building, looking at our capacity within the continent, looking at the Africans out there on what they can contribute, and are our country's governments ready? We tend to blame the people in the diaspora a lot, but there, in many cases, the frameworks for people to come and contribute are not there. So I think these are some of the things that we can look at. So I think for me, that's what really stood out. There's a lot that is happening, a lot of experiments. I think the East Africa community also talked about, oh, this student from some university in, I mean, every university now in Malawi, you have the Malawi University of Science and Technology. Even where Dr. Ngwira here is at the Kamuzu University of Health Sciences, students are innovating. Innovations all day, in the end, I think, well, how do we make sure that we learn about these? What mechanisms do we have to assess what they are doing? Because no matter what, when you look at that population of 1.5 billion becoming 2.5 billion, what will matter in the end is bringing small experiments to scale. That's when these innovations will reach more people, will have greater impact. So as we think about these technologies, the emerging technologies, I think the issue about patenting, the issue about how do we protect the innovations, but more critically, what are the mechanisms that we'll have to bring the ones that are really effective, impactful, that are proven, to now adopt them to scale, because that's when then we'll reach millions, and turn this 2.5 billion people in 2050 into quality human capital that will drive the socioeconomic transformation agenda that we have in Agenda 2063. Thanks a lot, and I'll turn this back to Rose. Is it back to you? Oh, Maria, you are chairing this session. So I'm going, you said I should close. I wasn't closing. I was just trying to say what hit me in this meeting. I think it's a lot. I can't summarize it all. Jesse was trying to summarize, and I said, I don't think we should have another session. Maybe tomorrow we'll have a wrap-up session. But really, it's been great. I'm uplifted. And I hope tomorrow will be the same. Thank you very much.
Thank you very much, Dr. Elia. We're done. Just share with me the boarding pass and have a good evening. Oh, and any other receipts that you might have for transport, for visa, in case you paid for the e-visa, please. We need those. Other than that, have a good evening. And yeah, you can go around. Nairobi is nice.